More questions than answers.
Radio Cayman, talk today.
Oh, what a compliment. For that, I thank you.
What is happening now? They are hopeless and hungry.
Now it's time for us to stand up for God or we fall to nothing.
It's time now for Radio Cayman's Talk Today. If you're ready to talk, we're willing to listen.
Cayman Islands' foremost listeners participation program.
Radio Cayman's Talk Today.
Listening to the general public, what the public is saying.
And good afternoon and a happy May 29th, Radio Cayman Nation, and thank you for tuning in to your station of the nation, Radio Cayman. I'm Raymond Singh, filling in for Mr. Sterling Dwayne Ebanks. Thank you for letting us into your homes, cars, and offices for today's episode of Talk Today. On today's show, we will be hosting our annual Hurricane Preparedness Panel with an extensive lineup of guests from Hazard Management, the National Emergency Operations Center, Social Services, including NAU, the HSA, the Red Cross, and the Pines Retirement Home, and infrastructure, including telecoms, utility, and climatology. While the world has grappled with COVID-19, the social conditions have highlighted the importance of being prepared. Lest we forget Ivan in 2004, or the recent span of devastating Category 5s to our Caribbean neighbors, from Maria and Dominica in 2017, Irma in Cuba in 2018, and Dorian in the Bahamas just last year. As such, we do extend our appreciation to our panelists on today's show for their diligent efforts towards our island's hurricane preparedness strategies, and continue to pray for good fortune through this year's season. While we do wish to always encourage your stories, feedback, and questions due to the national importance of the information that our guests will be sharing, this week's Frontline Friday segment will be postponed until next week, and we do ask that you send any questions to our WhatsApp at 925-3261. Stay tuned for more Talk Today following this brief disclaimer.
Talk Today is brought to you by Fidelity Bank. For all your banking needs, visit fidelitygroup.com. Fidelity, we're good for you.
Also brought to you by greenturtle.ky. Take a ride on the Green Turtle Express today. Download the Green Turtle app. The future of mobile. Saving lives today.
Radio Cayman's Talk Today, the Cayman Islands' foremost listeners participation program. We ask our listeners to avoid statements or comments which are abusive, derogatory, malicious, or defamatory. Do not use any indecent language or make any statement which is false or misleading. Email talktoday@candw.ky or call 1-800-534-8255.
Courtesy of Live Communication.
Let your voice be heard. Radio Cayman's Talk Today.
And welcome back to Talk Today. In case you're just tuning in for today's show, I'm Raymond Singh, filling in for Mr. Sterling Dwayne Ebanks, and we are hosting our annual Hurricane Preparedness show today. And we have on the line Hazard Management Director Miss Danielle Coleman and Miss Laura Watler, and Miss Lizette joining us in just a little bit from the HSA. Good afternoon, ladies.
Good afternoon, Ray.
All right, so because we are working with my phone, I'm just going to isolate each one of you as we carry on the conversation. So we'll start with you, Miss Danielle. Welcome back to the show. You're no stranger to Talk Today. How have you been?
I'm great. It's sad not to be there with you in the studio. We always love being there in that room, but we are very close nearby at the Government Admin Building, working from the New York.
Well, we do miss having you in the studio. So there's been a lot going on. Obviously, the social conditions of the past few months have thrown the islands and the world in, a whole different wrench. But now with hurricane season upon us, that offers a whole different series of challenges. Walk us through what your office has been up to.
Again, it's been a really busy year for hazard management. From the start, obviously, we had the earthquake and the 24 aftershocks, as well as the tsunami scare, followed by COVID. Obviously, conversations started very early in January with Dr. Lee. So we've been kind of planning for that before we opened the New York, the National Emergency Operations Center. But obviously as well, so when we opened the National Emergency Operations Center on the 3rd of March, which we're about 80 plus days now, we've been sort of focusing really on COVID during that time. And again, just to give you a picture of what that looks like, the National Emergency Operations Center has 17 emergency support teams under the sort of the clusters of human concerns, emergency response, support services and infrastructure. So we're talking about approximately 100 people there, or maybe a bit more than 100 people, as well as obviously the policy group and the executive and our call takers, both evacuation and the National Emergency Operations Centre call takers. So it's a rather big operation. But, it's been an interesting, a very interesting challenge for all of us, I think. I mean, again, each day is a different day. We're dealing with very different priorities, or very different circumstances each day, is what pops up, a lot of different challenges. But I think the team itself is working very well together. And I think at this point, obviously it's a very well-oiled machine. Moving forward, though, of course, 1st of June is on Monday morning, and we're now considering, we have been for the last few weeks, but obviously we have to really put in place some concrete protocols for sheltering and what the hurricane season ahead looks like. We know already it's quite a busy season predicted, and whilst we hope we don't get impacted, we're also working obviously with our overseas territories, and in case they get impacted, how do we all work together to make sure we're sharing best practice, in particular about COVID response in shelters and how we deal with that, as well as our response, for example, in relief distribution, what that might look like this year as opposed to other years. But it's been a really good, I guess, teamwork so far, both in Cayman and across the overseas territories. And we're working, again, very closely with the UK security team, which is currently in from England, as well as the Governor's office. Again, that's a very solid relationship. So it's all moving forward in the right direction. But again, we're dealing with challenges that we haven't had to face in previous years.
Without doubt. And because if I remember correctly, you were in the Bahamas last year helping with their relief efforts.
I wasn't actually in Bahamas. We did some work for Bahamas. I did do the BVI trip in
the BVI trip. That's right.
Yeah.
That's right. That's what it was.
Yeah.
You mentioned the earthquake, and that seems like it was a couple of years ago, but in reality, it was just a few months ago. And you're absolutely right. Now, you referenced the major challenges this year with regards to isolation or self-isolation and social distancing with regards to the shelters. Miss Laura, can I put the mic on you to help us out and walk us through what that looks like for this year with shelter planning?
Yep, thanks. So we're looking at different plans for the social distancing and obviously getting PPE sorted for our different shelters. We're also looking at current shelter capacity, as well as maybe potentially bringing on new shelters as well. So we're not just looking at what we currently have, but what we can expand into as well, given the current environment with social distancing and making sure everybody stays safe throughout the season should we have something impact us.
Now, when you reference how many shelters do we currently have in place, and how many would potentially be coming online, and in what jurisdictions are we looking at, or what districts we're looking at?
So we've got 15 shelters online, and currently looking to bring that on to about 5 additional shelters in the various districts. I know that Cayman Brac is currently supported with their. They've got 3 shelters, so they're supported over there, and so we're looking at potentially bringing on 5 new shelters online for this season.
Okay. Now, with regards to the social distancing element and the 6 feet capacity, with regards to shelters, are we going to be seeing a reduction in how many people can be in the shelters, or how are those being managed internally within the shelters?
Yeah, so that's the ideal scenario, is that we're going to, that's the purpose of bringing on these new shelters, so that we're not going to kind of impact our numbers, be able to spread people apart and keep everybody safe. So ideally, that's the idea of bringing on the new shelters to even though we're going to have to put these social distancing protocols in place, that we have space for everybody and nobody's left outside.
Of course.
And as Lara says, I mean, again, it's an ideal scenario. We're doing our very best to get new shelters on.
Okay.
Of course, there are a lot of things you need to consider when you're talking about shelters, both, obviously the infrastructure, the elevation of the actual property above sea level. So there are other considerations. And whilst, again, we're really hoping to provide that sort of social distancing within shelters, if by chance we have a Cat 5 hurricane barreling towards us with significant storm surge, it may be that the lesser of 2 evils obviously is the COVID virus, and we have to focus more on getting people into shelters, saving their lives, but again, making sure they have the appropriate PPE. And we're asking everyone this year to have a plan in place, obviously, for which shelter you go to, if that's the route you're going to take. but have PPE with you ideally, a mask and sanitizer, because again, we will have some stocks, but we won't be able to have stock for the entire population who go into shelters. So we're encouraging everyone to be quite self-sufficient.
Yeah, I think that's the most important part, is that everybody have a plan this year, especially with going into the two scenarios with COVID and also a potential active hurricane season, is to have a family plan of where you would go and what PPE and what you would bring. So.
That's some excellent advice. I mean, the planning is always the big one, and as we talked about at the beginning of the show, I think the social conditions have really highlighted how important that planning element really is. Now, just to clarify, there will be, repeat what you just said, there will be PPE and sanitizers available, but the strong encouragement is that those who are coming to the shelters bring their own PPE and sanitizers.
Yeah, and food supplies. Obviously, shelters, we don't cook in the shelters.
Of course.
People do need to bring their supply of food and 3 to 5 days of food supply, but not, we don't, as I said, we don't cook. We're not asking for people to cook inside the shelters themselves. They'd have to bring sort of canned food and stuff that wouldn't need to be cooked in the shelters.
Of course. Now, is there any direct access that people can look online to find the information they need for the shelters, whether it be PPE, bringing food, babies, medication, elderly?
Yeah, we have a brilliant, I say brilliant, I'm sorry, I'm obviously very proud of this document, but it was way before my time, so I can't take credit for it. But on www.caymanprepared.ky, we have a full booklet, and it really does cover every eventuality between what hurricane supplies you need, your animals, your children, your household, planning for the aftermath, all that kind of stuff. So that is right in the front of our website. For anyone who doesn't have the information, it's a really good booklet for everything you need to know.
That's fantastic. Thanks. And if I'm not mistaken, we have Miss Lizette Yearwood on the line as well.
That's correct. Good afternoon.
Good afternoon. Thanks for joining the conversation. We're doing a little shuffling today. We have a lot of guests to get in. And Miss Lizette, how are you doing? And we haven't had you on the show, and I don't believe in a little while.
It's been a little while, yes, but I'm very happy to be able to join you all today. And we're doing great. We've been very busy here, and we're happy to be able to spare a few minutes to join you all and to be able to communicate with the people of the Cayman Islands to ensure that everybody is going into the hurricane season as prepared as possible. Obviously, we always encourage our patients to be empowered in regards to their own health and wellness, and this is really, really important for us going into the hurricane season, especially now that we also have the challenge of COVID-19 to deal with as well. So we're encouraging especially our patients with chronic ailments to prepare in advance, to make sure that they think about their own personal preparedness plan as well as their plan for their families, where they're going to be sheltering. We want them to, as usual, think ahead of time in regards to their prescriptions. Everybody going into the hurricane season who has a chronic ailment, we encourage you to have 2 weeks supply of medication on you at all times, and we want you to keep them in a watertight container. For persons that were around during Hurricane Ivan or certainly in the Sister Islands during Paloma will remember that, with the flooding that occurred, if you didn't have your prescriptions secured, they floated away in the flood waters. And then obviously we would be depleting the inventory here at the hospital if we had to be able to replace all of those medications for everybody. So everybody who has a chronic ailment have 2 weeks of their prescription medication in a watertight container that is safely stored, and that should be taken into the shelter if they're going to be going to the shelter for the duration of the storm. For elderly persons, we're very happy that we now have a delivery service for elderly persons. We want to be able to focus on them, especially with COVID-19 situation. They should make their needs known so that we can make arrangements ahead of time. I would really encourage people not to leave their personal preparedness for pharmaceuticals till the last minute because it can get quite congested. But elderly persons will be given priority, and we now have a number that you can actually WhatsApp your prescription refills to, and we would happily be able to fill them. That number is 925-666-6666. 6534. One of our groups of chronic patients that we're particularly keen on making sure have a good personal preparedness plan is our oncology patients, especially those that are receiving active treatment. We need you to make sure that you stay in close contact with your doctor, your primary doctor, your oncologist. If you're being treated here at the HSA, that number to call would be 244-2872 to make arrangements for your oncology needs. Also, our dialysis patients. Our dialysis patients, we encourage at all times to have their travel documents available, even though we know that the borders are closed. In the event that we are not able to provide dialysis care after the storm has passed, we will always liaise with the NEOC in order to make arrangements for them to be air evacuated if there are special circumstances that apply. So travel documents is something that everybody should always be mindful of year-round, but especially going into hurricane season. Check your passports. Make sure that they are still valid and they have 6 months, in excess of 6 months to the expiry. And have them, as well as all other important documents, also stored in a watertight container and as part of your hurricane preparedness kit. For those persons who will need to shelter in one of those that have an emergency medical center, there are 7 emergency medical centers around the island, and they're all identified in on the website. We also have one in the Sister Islands. Those emergency medical centers, also referred to as EMCs, they're staffed with a medical doctor, a midwife, a registered nurse, as well as a mental health professional. And they're there especially to be present for the most vulnerable, those persons who are, maybe have a chronic illness that don't need to be in a hospital, but they're oxygen dependent at home, they're wheelchair bound, they're diabetics or hypertensives, who are asthmatics indeed, who may have an emergency during the storm. We encourage you to go to one of the EMCs. You should make sure that your nurse in your district knows your name, has your contact information, so provisions are made for you. Now, the EMC is not to be providing medical services, but they're there to be able to respond to an emergency if it should arise during the height of the storm. And indeed, if there's problems with getting to the hospital after the storm, they're able to provide services at the facility after the hurricane. We wanted to encourage and remind persons who are going to the emergency medical centers that they too have to take their medication with them. We are not going to be having medication enough for everybody who's there. We only have medication that would be needed in case of an emergency. So take your personal prescriptions along with you, once again in a watertight container, and all of the other needs that you could potentially have. Of course, your food and your linen, and any other needs that you may have during the duration of the storm. And also, I just want to remind the public as well that the ambulance is not able to respond to calls after the island is impacted by tropical storm force winds. So if you are going to be needing transportation to the hospital, you need to make sure that you get in contact with them. But we're not able to respond during the height of the storm because obviously we can't put our personnel in harm's way. We want to make sure that you also remember when you're preparing your houses for the storm that you don't cover your house numbers. The house numbers is something that's very important for all of the emergency responders, and it must be visible at all times. So if you're going to be covering your windows, for example, with plywood, maybe you can write in big numbers, spray paint onto the plywood your house number so it's easily visible. Because after the hurricane, if you do need emergency services and there's a lot of debris around, it may be difficult for the EMS team to see the number on your house in order to be able to identify where they are responding to. So that's something that we just want everybody to be mindful as well. But ultimately, the principle is still there. Be prepared, plan in advance. Everybody knows what hurricanes will present to them, but given the COVID-19 situation, we do have additional challenges. And going into a shelter, persons need to make sure that you walk with a mask. Everybody will be required to wear a mask in the shelter and have their own hand sanitizers. So the same principles that we've been talking about for the last few weeks about social distancing and good hygiene, good hand hygiene and sneeze etiquette, those things need to also be exercised in the event that persons need to go to a shelter during the hurricane.
Ms. Lizette, thank you. That's a wealth of information you just provided the public there. Thank you so much for that. And thank you to you and all the HSA members who for all the efforts they have put in throughout the past several months. Ms. Danielle, Ms. Laura, we did have to go to a commercial break. Is there anything else you would like to add on the isolation facilities?
I guess just a couple of things again to bear in mind. I think Lizette covers a heck of a lot of it, and thank you, Lizette, as always. You're doing a tremendous job over there. Communication is obviously a really important factor because we're so used to using electronic means through the social distancing and the restrictions we currently have. So having a backup plan for your communications and knowing in your family plan where you'll meet again in the aftermath of the storm is really important. But again, we're really plugging people to make sure their personal prep is up and running and their plan is in place, and they're testing their plan with the requirements of COVID as well. And Lara's just got a quick mention about mental health.
Yeah, so obviously we've been with the earthquakes and fires and COVID-19 going into this season. It's very important to remember your mental health and to remember to take care of that side so that you get your breaks and everything else. So I just wanted to remind everybody that we've got the mental health hotline. It's 1-800-534-6463. So again, to remember to take care of your mental health, and we're here to support should you need anything as well.
Ms. Danielle, Ms. Laura, thank you so much for joining us today on Talk Today, and all the best, and thank you for everything you've done and are continuing to do. We'll be back to our listeners with more Talk Today right after this commercial break.
Social distancing is crucial for our community to get back to normal, and never before has communication been so crucial. Keeping in touch with family, friends, and up to date requires you to stay in touch. Green Turtle offers the solution for both. Download the Green Turtle app now. Top up yours or a loved one's phone with any mobile carrier in any destination in Cayman. Phones delivered to your home, and with the new rewards program, you can even redeem points towards a new phone and other products. Download the Green Turtle app today. Green Turtle is not only the future of mobile, but today it can help save a life. Hashtag Stay Home Cayman. Take a ride on the Green Turtle Express today. Download the Green Turtle app. The future of mobile, saving lives today.
A.L. Thompson's has reopened to the public. Shop for all your home and garden needs at A.L. Thompson's in any of 3 ways that suit you. You can come to the store and shop in person. You can shop online for curbside pickup. And you can shop online for delivery to your home. A.L. Thompson's wants to make your shopping easy, efficient, and safe. We offer goods that you need now for your home and yard. For shopping details and procedures, please visit althompson.com.
Bring a little bit of luck to your house with Lucky Slice from America. Burgers, steak, and the all-day American breakfast. From Europe, fish and chips, pizza and crepes. And from Asia, sushi.
Breakfast, lunch, or dinner, 7 days a week, delivery or pickup, 10 a.m. to 8:30 p.m. In these difficult times, we can all use a little bit of luck. Keep calm and stay lucky.
Minimize contact. Make your credit card payment by phone. Pay only for food. No delivery fee. No service charge. Certain restrictions apply. Call Lucky Slice Pizza to place your delivery order now. 949-3456.
Order from Cayman Creperie, Mojo Sushi, and Lucky Slice Pizza. Call 949-3456.
Obey the laws and wear the gauze. Protect your jaws from septic paws. Stay clean, Cayman. Reflection sells hand sanitizer from $2.99. 10 surgical masks are only $9.99. And the best KN95 masks from only $3.30. Volume discounts available at all 5 Liquor for Less locations. Shedden Road, North Church Street, Savannah, Northside, and the McClendon Drive Airport location. Don't miss the Liquor for Less incredible lockdown price markdowns. Hundreds of fine from $2.99. Cases of ice cold below wholesale prices. Save $9 off liters of. Enjoy our manager specials exclusively at Liquor for Less. Prices so low, we can't say them on the radio. Liquor for Less enforces the wearing of masks, social distancing, and preventative measures to help stop the spread of COVID-19, such as consistent hand washing and only leaving home for essential purposes.
International Lighting, Ed's Plaza, North Soundway is now open for curbside service and delivery Monday to Saturday from 8 a.m. to 5 p.m. In addition to light fixtures, ceiling fans, rugs, sheet sets, and household items, International Lighting now has a selection of 3-ply masks starting from $1 CI, as well as non-disposable masks, rubbing alcohol, and gloves for sale. For curbside service and delivery, please call 945-7121, 916-8211, 916-3553 or 949-5141. Stay safe, Cayman. Christian Enlightenment Center is now open for deliveries. Call and order your favorite inspirational books, journals, Bibles, Bible cases, church supplies, stationery, and many other unique items. Christian Enlightenment Center, your complete Christian bookstore and more. To place your order for delivery, text or WhatsApp 923-8050 or email us at ceccenter@candw.ky. Check out our website at christianenlightenmentcenter.com. Browse items on your Facebook page by clicking shop to view all our collections. Opening hours 10 a.m. to 3 p.m. Monday to Saturday.
Listen to the general public.
Your thoughts are just a telephone call away. 1-800-534-8255.
What the public is saying.
Let your voice be heard. And now,
Radio Cayman's Talk Today.
And welcome back to Talk Today. In case you're just tuning in, I'm Raymond Singh, filling in for Mr. Sterling Dwayne Epanks, and we are hosting our annual Hurricane Preparedness Panel. We just recently had on the show Miss Danielle Coleman, Miss Laura Watler, and Miss Lizette Yearwood, and we're now pleased to have on the air Miss Paulinda from the NAU, DCFS and NAU, Mr. Eddie Tingling Miller, and Dr. Williams from the HSA. And good afternoon, everyone.
Good afternoon.
Good afternoon. So, Miss Paulinda, we'll start with you. One, how have you been? I know you've had a busy few months here with the recent social conditions. How are things in your camp?
It's rolling but steady.
Good. Well, at least you're rolling forward, right? You're rolling forward, not backwards, right?
Rolling forward.
Good.
You know, one day at a time.
That's all.
Just for clarity, my role on the New York is human concerns, and DCFS NAU forms a part of that.
Okay.
Yeah.
Thank you for that clarity. So human concerns under part of NEOC. All right. So I understand there's been some recent shelter management training.
Yes, there was, and it took place on Wednesday afternoon. It was our first time doing a Zoom training for our shelter managers and volunteers who will be supporting us during this hurricane period for 2020. And of course, we all know that the hot topic is sheltering during a pandemic, COVID-19.
Sure.
The training, we saw about 100 plus persons who were in attendance, and of course our partners on our human concerns, they did their presentations for the training. Red Cross, Department of Environmental Health, the Health Service Authority, the Royal Cayman Islands Police Service, Public Works, HMCI, and the Department of Children and Family Services. It was a 3-hour training, and we also were able to do Q&A, but we're also going to be hosting an additional training for persons who are designated as the shelter managers in June.
Okay, so there will be another training session for those individuals. Now, we just had on the line Ms. Danielle from Hazard Management, and there was the mention of the potential of 5 new shelters opening up in the various districts, along with Ms. Lizette confirming that there was 7 emergency medical centers being set up. What else new can the public expect in the event that the shelters are needed in 2020 with the COVID issues in the works? What else can be expected?
So, of course, with COVID-19 and the various protocols for safety, the numbers in the shelters will definitely be decreased to ensure that we are trying our best to maintain that level of social distancing. So we will be looking at possibly maybe a 40 to 50% decrease in capacity to ensure we're complying, but also making sure people are kept safe.
Without doubt. Okay. So obviously the reduced numbers. Is there a rough percentage of what the reduction will be per facility? Is there a percentage, or is it?
Well, they're working out, HMCI, they're the ones, along with Public Works and some other persons, who are determining what the square footage, the social distancing within a shelter will look like. Again, the numbers are roughly between 40 to 50% decrease in capacity. So, for instance, a shelter that would house 1,000 plus people, you're looking at probably 500 to 600 persons, depending on what the calculations are from the square footage that they consider safe and non-threatening in that environment.
That's a significant decrease, which is even more reason why we're holding this show and why the public needs to be aware and prepared. For those that have more information on the various shelters and the differences that will happen this year, how can they find out more information other than the caymanprepare.ky website?
So one of the things that we have been speaking about is definitely doing more of these on-air sessions, working with COMS, GIS in providing information to the public to ensure that they know what's happening, what to take into the shelters, what to expect, what shelters are online, and so forth. Okay, so we're looking at more on-air information sessions. Okay, that makes sense. As far as the now, in speaking with Ms. Danielle and Ms. Laura before, just for avoidance without scaring the public too much, with regards to the reduction in the number of the capacity at the shelters, as Ms. Danielle was saying earlier, in the event there was a massive storm that did hit us and we were caught in it, the reality, are we looking at a situation where lesser of two evils is that to save the person in the immediate future, we're not going to turn away anyone from the shelters? Is that correct? Absolutely. Okay. At the time, God forbid that we have to, have one of those Category 5 type hurricanes where we're seeing more persons utilizing the shelter during this time, it will definitely be looking at the fact that right now we want to save persons in the immediate future. We'll deal with the COVID piece at a later date, because the importance is definitely ensuring that we preserve life. Okay. Thank you for that. And then last question from my end is with regards to, you mentioned the 100 plus individuals involved in the operation of the shelters. If individuals are looking to volunteer with these shelters, is that still available, those opportunities, or how can the public find out more about those opportunities? So one of the things, we did get 190 persons that actually submitted applications to be a part of the shelter management training. And what happened, honestly, I guess some persons, maybe the timing of it, again, this type of training normally took place over 2 days, and it's something like we spend about 8 hours between the 2 days doing this training. It's quite intensive. But that being said, we did it from 3 to 6, and it may have been a bit of a challenge for some persons to log on at that time. But again, when we have to activate shelters, one of the things that the managers and the volunteers do ask, the law does require persons to identify their occupation. And through that, we're able to seek support within the shelters once we activate. Because if you have persons who come in who may be doctors, nurses, counselors, social workers, and they identify themselves, the shelter volunteers, the shelter managers, if needed, can ask for their assistance for any specific need at that time. So that's one of the ways that we're able to still get the public involved, even if you haven't registered or gone through the training. But again, when we are activated and in sheltering, it's all hands on deck to ensure everyone's safety.
Of course. You raised actually another question that I came up with. You mentioned the Zoom training. With everything changing and us many moving to these online conference apps, how did you find that with regards to having to accommodate a training for this many people?
So again, like I said, we were treading in new waters.
Very, very new waters.
By doing the Zoom, again, normally with these types of training, when you have it person to person, you're able to have more conversation after one section is presented to do that level of Q&A. Again, we kept the Q&A till the end. We did have some questions, not in the amount that we normally do when we have it in our regular type setting. But again, because we had to scale down, there were certain pieces that we were not able to incorporate. However, with the manager's training that will be coming online, the intent is to ensure to include those pieces, like the use of the radios, demonstrating that. Of course, the participants wouldn't be able to actually engage in using the radio, but they will see from the demonstration from the presenter how to use the radio and to be able to ask questions as well. What we will also be doing is looking at more scenarios during that training, so managers are able to think on their feet, just developing different scenarios that may occur while sheltering, whether it's during the registration phase or whilst persons are all in there. So creating scenarios that will generate productive conversations and bring about solutions to the situation.
Great. Thank you so much, Ms. Pelland. And you're doing fantastic work, and all the best with, hopefully we don't have to have this conversation again this year, and things go very well for all of us in Cayman. Mr. Eddie, Dr. Williams, on that note, we have to go to our 1 p.m. headline news. When we come back, Eddie will be coming to you to discuss the Red Cross sheltering options. I'll be back with more talk today following this 1 p.m. headline news.
Today's biggest news.
Radio Cayman.
It's only 2 species that we have, on Island.
Generations present.
Your voice, your choice.
It is in the best interest of the people of these islands.
Local, regional, international. This is Headlines from Radio Cayman's newsroom.
Today's biggest news.
No positive COVID-19 cases were reported on Thursday as government released results for 292 samples. That means Cayman has held steady at 140 total confirmed cases out of 10,466 tests. 67 patients have recovered and no cases have presented for clinical management since April 27th. The HSA lab is doing schedule maintenance today, which may affect test results being reported at today's COVID press conference at 2 p.m. right here on Radio Cayman. Good afternoon, I'm Dion Anglin with your headlines and news elsewhere. Minnesota Governor Tim Walz says he expects justice for the death of an unarmed black man in Minneapolis police custody will be swift. There have been days of protests, looting and arson after an officer was filmed kneeling on George Floyd's neck, even as he said he could not breathe. Mr. Walz said justice for the officers involved in Mr. Floyd's death will come in a timely manner and will be fair. The case has added to U.S. anger over police killings of black Americans. And Twitter has hidden a tweet by U.S. President Donald Trump from his profile, saying it violates rules about glorifying violence. It did the same hours later when the official White House account tweeted a copy of the president's words. Instead of being deleted, both tweets can be viewed by clicking on a prominent warning. It says that Twitter has determined that it may be in the public's interest for the tweet to remain accessible. That's a wrap of your headlines. I'm Dion Anglin.
For the latest in news and information,
Follow Radio Cayman on social media, Facebook, Instagram, Twitter. Download the Radio Cayman app or log on to our website, radiocayman.gov.ky.
Your voice, your choice, your radio.
Honey, our fridge has stopped working again. Everything in the freezer is melting. We need to get this repaired right away. I'm calling Brand Source Service.
When you need the very best appliance service, call Brand Source Service at 623-5000. Offering service and installation of all brands and models of appliances. Brand Source Service is Cayman's source for appliance parts and repairs with qualified and experienced technicians and the island's largest stock of appliance parts. Brand Source Service will have your repair completed in a flash. So, whatever the problem is, call the experts at 623-5000. Brand Source Service, Dorsey Drive, Industrial Park. Telephone 623-5000.
At Seaboard Marine, customers often ask us questions about their shipments.
I have various items coming from different suppliers that I need to ship to Cayman. Do you offer consolidation?
Yes, Seaboard Marine offers consolidation for full and less than container loads. We can hold your packages at our Miami warehouse until everything arrives and ship it all in one go. And we have the best rates to Grand Cayman. Visit seaboardmarine.com for more information.
Shipping shore to shore, Seaboard.
Wow, looks good. What is that?
Chicken chair.
What did you just say to me?
Chicken chair.
I am not a chicken.
Whoa! I said chicken share. It's from KFC. Bucket of 12 hot wings, 6 pieces of chicken, or 8 tenders. KFC chicken share. Just $12 each.
Oh.
Want some chicken, tenders, or hot wings?
You're sharing your chicken share with me?
The new chicken share from KFC, just $12 each, and it's finger-licking good. Dine at KFC Baytown Plaza, KFC Shedden Road, or KFC at the Strand.
Social distancing is crucial for our community to get back to normal. And never before has communication been so crucial. Keeping in touch with family, friends, and up to date requires you to stay in touch. Green Turtle offers the solution for both. Download the Green Turtle app now. Top up yours or a loved one's phone with any mobile carrier in any destination in Cayman. Phones delivered to your home, and with the new rewards program, you can even redeem points towards a new phone and other products. Download the Green Turtle app today. Green Turtle is not only the future of mobile, but today it can help save a life. Hashtag Stay Home Cayman. Take a ride on the Green Turtle Express today. Download the Green Turtle app. The future of mobile, saving lives today.
Listen to the general public.
Your thoughts are just a telephone call away. 1-800-534-8255.
What the public is saying.
Let your voice be heard. And now,
Radio Cayman's Talk Today.
And welcome back to Talk Today. In case you're just tuning in, I'm Raymond Singh, filling in for Mr. Sterling Dwayne Ebanks, and we have our annual show today on hurricane preparedness. And on the line, Mr. Eddie Tingling Miller of the Red Cross. Good afternoon, Eddie.
Afternoon, Raymond. How you doing, sir?
You know, we're doing great. How have you been holding up these past few months?
I'm doing my best. I think we're all doing the best we can in these unprecedented times. But people that know me, I'm a community man through and through, so it has been very difficult in the confines of my apartment. But we're doing their best. We're doing the best we can, and we're making some good progress. So,
well, good for you. And as far as the, if I'm reading correctly, you're the coordinator for the volunteer agencies as part of NEOC. Is that correct?
Correct, yeah. So just speaking to Paulinda or Danny speaking earlier on the show, basically in the National Emergency Operations Centre, it's split into 4 clusters. One of those clusters is human concerns, which Paulinda is actually the chair of the DCFS. And under that cluster falls some emergency service teams, ESTs, and the VARS committee, the Red Cross chairs, which is Voluntary Agency Responders or Relief Subcommittee. And in a nutshell, what we would do there is we've been coordinating with all the service clubs, NGOs and charities, or in this case, volunteers, about coordinating efforts and response in the community, primarily at the moment during COVID response, but obviously it'll be utilised in the unfortunate event of a hurricane, etc.
Okay, and with regards to how did you find the training the other day, how that took place? I believe Ms. Paulinda was mentioning it was a varied training from prior years with the Zoom element in place.
Absolutely. Like I said, it's a new thing for all of us, and usually we all meet together at John Gray Canteen Hall, and the training split over 2 evenings. But I've got to say, I thought the attendance was fantastic. Like Paul Linder said, we had over 190 people partake, which is far exceeded previous years' numbers. There was some good content that was covered, good questions asked and answered at the end, and all the relevant parties came together to make it a success. So yeah, it was very good. Again, there could be some questions that people wanted to ask but couldn't get them through, but we did mention several times that they could make contact with us offline if they wanted those questions answered. Sure. Another thing we're going to consider as well is obviously respecting to people that want to be volunteers who aren't obviously familiar or au fait with technology as others. So we're just trying to think of other avenues as we can in the event of social distancing, etc. How we can reach out to those people who aren't so good on their iPhone or iPad and things like that. So, yeah.
Now you mentioned your group has been dealing with primarily the current COVID response right now. With regards to the hurricane preparedness element, are you dealing with different NGOs and volunteers as part of those efforts, or are this all falling under the same umbrella of NEOC?
It does fall. It would fall under the same umbrella. And at the moment, the VARS aspect is really mainly being covered for COVID response, and we've had numerous people. We actually put together a training session. So basically, volunteers from all NGOs, not just Red Cross, could go on the training session, register as a sort of COVID response volunteer, and then any assignments that would come through from government or other agencies, we could fulfill those with those volunteers who have registered. Okay. As it pertains to hurricane preparedness, it would be no different, and what we're trying to tell people, the presentations I've been giving to numerous VARS NGO clubs over the last few weeks, is that the information that is there, I've been mentioning, but it's not just for COVID response. This is something that we would want going forward for the future. As we know, January we had the earthquake, and then end of February we had the landfill fire. So they're all sort of things that the VARS members could be part of if there was a community effort, yes.
Okay, great. Thank you, Eddie. I appreciate that. Anything else you want to add really quickly?
I think Danny covered a lot of the things in terms of hurricane preparedness.
She did.
As it pertains to shelter training for us, we're doing an actual online training platform for our volunteers. Okay. The Red Cross volunteers in particular offer assistance with first aid in the government shelters as and when they open. But as it relates to ours, the Red Cross shelter is the first national emergency shelter to open in the country in the event of a disaster.
Sure.
And it was utilised during the earthquake and the fire for several days, and we did have a few shelteries come there. As it pertains to hurricanes related to COVID, again, Paul Linder was mentioning about the respect of social distancing and the potential capacity to be almost halved. And that is the procedure that we would follow with our shelter as well. So,
okay, great. Eddie, thank you so much for joining us today.
Thanks, Raymond, very much.
All right.
Thanks.
And Dr. Williams, thank you so much for your patience throughout this segment here. How have you been holding up?
I've been doing well. Hi, good afternoon to you and the public, the audience.
Good afternoon.
We're doing well. Quite busy, but we're doing well. Thanks God.
Thank you. Now, we had Miss Lizette on the show about half an hour ago. Is there anything else you would like to add from the HSA standpoint with regards to this year's hurricane preparedness?
Yes, it's just one point. I know the CEO has covered most of the points. It's just one additional point we want to mention just for clarification, and I have to apologize from now because I'm going to have to drop out of the call as soon as I make that point. I have to deal with that urgent matter. But just want to advise the public that because of the COVID-19 situation, if any person is experiencing symptoms that could be suggestive of COVID-19, and those symptoms, as we have mentioned before, are cough, fever, sore throat, loose stools, conjunctivitis, any of those symptoms, please don't go to the shelter. What we advise them is for them to contact the healthcare provider or to contact the HSA for advice or where to go. But we don't want them to actually go to the shelter if they're having these symptoms because of the risk that it could be COVID-19. Of course, the last thing we want is to have an outbreak of the disease in one of the shelters.
Okay, thank you so much for that point. That's actually an excellent point. Thank you so much, Dr. Williams, and again, thanks for your patience today.
All right, thank you very much. Take care now.
All right, thank you. Before we head off to meet with our next guests in regards to this year's hurricane preparedness, just a couple quick reminders of what we've discussed so far on the show, because there's been a lot of information that's been shared thus far. One of the big changes with regards to this year's shelters is the need for the PPE and sanitizers. The folks at Hazard Management has reminded the public that in the event you do need to go to shelter, while there will be some supplies of PPE and sanitizers on hand, that just like food, you should bring your own PPE and sanitizers as well as your food and medication. The capacity at our shelters this year will be reduced, so it requires extra planning on your part. Although there will be new shelters opening up, that information will be forthcoming. We have 7 emergency medical centers as part of those shelters, and as Dr. Williams just mentioned just now, if you are showing symptoms, flu-related symptoms, and the full list was referenced just now, not to go to the shelters, but rather to contact your healthcare provider or the HSA for advice on what you should do and how you should proceed in that situation to avoid a outbreak of COVID within one of the shelters. A couple of other major information was the HSA delivery service. They have set up a WhatsApp phone number, 925-6534. They are looking to help, especially the elderly. So any information you need on that, 925-6534 to WhatsApp your medication, your prescriptions, and then the mental health number with so much going on, and they've referenced it so far today in the show between the earthquake, the fire, the COVID situation. Now we're into hurricane season to take care of your mental health. The mental health hotline is 1-800-534-6436. On that note, we will take our next caller. We believe we have on the line Mr. Mark Codling from the Hazard Management Unit. Mark, you're on the line with us. Good afternoon, Mark. Are you there with us? Oh, we may have lost caller. So on that note, we'll take a quick commercial break, and when we come back, we'll be meeting with the rest of the team from Hazard Management Cayman. We'll be back with more talk today right after this commercial break.
The Motivational Messages series has brought hope to persons across the Cayman Islands and across the globe. This coming weekend, the finale of the Motivational Messages series is coming to a computer near you. Stand-up comedy with comedian Dr. Dexter Thomas and a virtual global concert featuring artists from all over the world. Enjoy songs from various genres, featuring special songs from artists such as the Williams Quartet, Conqueror, Committed, the Aeolians of Oakwood University, the Katinas, Paul Lee, Tone 6, Scavos, Nisa, Ian Webster, Sean Warren and Daniver Scott, Lost in Harmony, First Light, Jay Prophet, Lorene Cato, Cobblums Asukuo, Pastor G, and so many more. This is a virtual event you do not want to miss. Mark it on your calendar, Saturday, May 30th, 2020 at 7 p.m. RSVP to this event to be eligible to win a prize. Prizes include Amazon and Hurley's vouchers, a basket of premium mangoes, and so much more. Spaces are limited, so you definitely want to RSVP. Feel free to make a donation. All proceeds will go towards persons affected by COVID-19. So remember, Saturday, March 30th at 7 p.m., the Motivational Messages finale, a global virtual concert and comedy show. This is an epic event you do not want to miss. See you there. This event is proudly sponsored by Oxbridge RE, the Ashley Shillingford Foundation for Positive Living, Salt Lake City, Radio Cayman, Praise 87.9 FM, 90 Degrees by JS Fashions, Sophia and Paul Harris, Jay Madu, Dr. Rendon and Alicia Timothy, and Pauline Green. Visit motivationalmessages.org for more information.
Social distancing is crucial for our community to get back to normal, and never before has communication been so crucial. Keeping in touch with family, friends, and up to date requires you to stay in touch. Green Turtle offers the solution for both. Download the Green Turtle app now. Top up yours or a loved one's phone with any mobile carrier in any destination in Cayman. Phones delivered to your home, and with the new rewards program, you can even redeem points towards a new phone and other products. Download the Green Turtle app today. Green Turtle is not only the future of mobile, but today it can help save a life. Hashtag Stay Home Cayman. Take a ride on the Green Turtle Express today. Download the Green Turtle app. The future of mobile, saving lives today.
The efforts of those working behind the scenes are crucial to sustaining our community. Groups like the Needs Assessment Unit are often misunderstood and unappreciated. Like the roots of a tree, they hold us up, keep us fed, and without their dedicated diligence, we would simply topple over. To the civil servants of the Needs Assessment Unit and all of the men and women in our social services network, on behalf of all those in our Cayman Islands who rely upon you, you are appreciated. Hashtag Cayman Strong.
You may be home isolating, but your taste buds can explore the world. Dragon Inn Restaurant and Countryside Plaza, offering savory dishes in traditional, authentic, American, Szechuan, Mandarin, Filipino cuisine, and Cantonese style, made fresh daily. Family dinner specials, rich in taste with no MSG. Choose from stir fry, chop suey, chow mein, sweet and sour, and so much more. Call 947-1166. Pick up Monday to Saturday from 10:30 a.m. until 7 p.m. Delivery 7 days per week until 9 p.m. Dragon Inn Restaurant and Countryside Plaza. Daily lunch specials and combinations, bringing international deliciousness to your doorstep. Call 947-1166 to place your order.
Home, which should be a haven, can even be less of a safe space during curfew if someone is experiencing child abuse. If you or anyone you know is being abused, help is nearby. For emergencies, call 911. They will redirect your call to the relevant agencies. For general guidelines and inquiries, call the Multi-Agency Safeguarding Hub, MASH, at 1-800-534-2273 or 945-0545. Alternatively, email mash@gov.ky.
Hi, my name is Neraya LeBlanc. I am the minister and evangelist to the West Bay Church of Christ on 24 Batabano Road. I would love to take this opportunity to invite you to experience God's family at West Bay for yourself. We are a caring congregation that strongly believes in reaching out beyond ourselves to spread the gospel of Christ. We also take great pleasure in ministering to the needs of our people in our community. As God's called out kingdom people, we are in the business of transforming lives for the Master's use. For more information, you can visit our website at westbaycichurchofchrist.org or call us at 946-9294 or 917-1809.
Declaring the word of the Lord.
Cayman Islands Church of Christ presents Word of the Lord.
Word of the Lord, heard Sundays at 6:30 p.m. on Radio Cayman.
Obey the laws and wear the gauze. Protect your jaws from septic paws. Stay clean, Cayman. Reflection sells hand sanitizer from $2.99. 10 surgical masks are only $9.99. And the best KN95 masks from only $3.30. Volume discounts available at all 5 Liquor for Less locations. Shedden Road, North Church Street, Savannah, Northside, and the McClendon Drive Airport location. Don't miss the Liquor for Less incredible lockdown price markdowns. Hundreds of fine from $2.99. Cases of ice cold below wholesale prices. Save $9 off liters of. Enjoy our manager specials exclusively at Liquor for Less. Prices so low, we can't say them on the radio. Liquor for Less enforces the wearing of masks, social distancing, and preventative measures to help stop the spread of COVID-19, such as consistent hand washing and only leaving home for essential purposes.
Fidelity Bank would like to thank all essential workers. We salute your efforts and thank you for the sacrifices you've made to keep us all safe. During these challenging times we're facing, our top priority is the health and safety of the communities we serve. And while it's true that things are changing rapidly every day, one thing that will never change is our commitment to giving you the best and sound financial solutions to help you during and after the coronavirus pandemic. At Fidelity Bank, our focus will always be you. Fidelity, we're good for you.
Listen to the general public.
Your thoughts are just a telephone call away. 1-800-534-8255.
What the public is saying.
Let your voice be heard. And now,
Radio Cayman's Talk Today.
And welcome back to Talk Today. In case you're just tuning in, I'm Raymond Singh, filling in for Mr. Sterling Dwayne Ebanks, and we are hosting today our annual Hurricane Preparedness Panel. While we do always wish to encourage your stories, feedback, and questions, due to the national importance of the information that our guests are sharing today, we have postponed today's Frontline Friday segment, and we do ask that you send any questions to our WhatsApp at 925-3261. On that note, we do have a team from Hazard Management Cayman Islands, Mr. Simon Boxall, Mr. Mark Codling, Mr. Leslie Lennox Fernan, and Ms. Teresita De Silva. Good afternoon, everybody.
Good afternoon.
To make sure we stay in order here, we'll start with you. How have things been progressing with your team over at Hazard Management?
Things have been going well. To be honest with you, my specific role is related to shelter, logistics, and such. And things have been coming together despite the impact of the COVID-19 suppression protocols. We're getting by with all that we need to do.
Okay, now with regards to the shelter logistics that you mentioned, which falls under your umbrella, what changes are you finding regarding the shelter logistics for this year?
Well, the biggest one to start with would be the physical distancing or social distancing that impacts the volume or capacity in the shelters. But we figure more or less we're going to be experiencing a reduction about 50%. Following that, the other challenge is services to get the shelters ready. For example, we conduct pest and vector control, sanitization, cleaning, and things like that, as well as ordering supplies for the shelter. That has been a bit of a challenge considering that businesses are working with limited capability, as well as the ability to order additional items and so on. But so far, we are getting our wish list checked off, so things are looking good.
Okay. That's excellent. Now, we heard Dr. Williams mention earlier the recommendation, strong recommendation for people that are experiencing the flu-like symptoms not to go to the shelters. How does that affect with your planning in the event that does happen?
Well, to date, we are basically going to open or have available, rather, the 15 shelters that was available in 2019. Okay. In addition to that, because of the reduced numbers, we're planning to inspect and add additional shelters very, very soon in the season, hopefully by mid to late June. In addition to that, though, we are considering, or I should say the government is considering, looking at a facility to house COVID positive / suspect cases and so on, and we're going to work closely with our partners at HSA to achieve that. I can't say for at this time that it is in place, but like I said, the idea has arisen, and we're going to be working with them to put something in place that the general population don't have to feel any fear in going to a regular shelter.
Okay, that's I'm sure there's a lot of people that are happy to hear that extra step being put into place. Thank you. Mr. Mark Codling, are you on the line with us still?
Yes, Raymond, I'm here.
Mark, thank you so much for your patience for waiting there. So walk us through what you've been working on with Hazard Management and your team within NEOC.
Well, currently, from the side of the mitigation, what we're looking at is doing some storm surge mapping. So we're looking at the possible impact of various heights in terms of from a 20 feet to a 15 down to a 10 increments of 5. So we're looking at how would, in terms of assets, buildings, infrastructure would be impacted by such storm surge.
Okay.
Additionally, also, as it relates to COVID, we are working closely with the HSA on mapping the various locations and actually doing various analysis as it relates to the impact of COVID on the general population itself. So we're working close with our partners, and as Lennox addressed earlier in terms of the whole shelter operations, we're working closely with PWD as it relates to mapping certain assets and developing mobile apps where we can able to collect data in the field and synchronize at real time to our National Operations Center.
That's quite a very technical element. If I can deviate back to the question, you made a comment there regarding mapping, regarding the current COVID situation. Are you able to share a bit of information on how that's been progressing?
Well, I think it's progressing relatively good. So what we're actually doing is just to look in terms of clusters in terms of the different public spaces. So we map our public spaces, our supermarkets, areas persons will congregate, and we could look at several models to say how would this spread impact certain areas where persons congregate. So we look at those areas where persons are normally clustered together. So if we reopen the economy, we look carefully in terms of such areas where persons would congregate. So it's really projecting and see what could be the potential spread, so we can mitigate and put all the various strategies in place.
Okay. And then you referenced, with regards to the hurricane planning situation and the mapping that's going on, given the state of development with some projects which were stalled and some that are reopening, and just the constant development that we do see on the islands, what mitigating factors or what risks are you seeing in your models and your planning?
Well, given that if there is no tourist season currently for the next couple of months, what you're looking at is in terms of buildings being occupied by persons. So we look keenly on the population itself, the risk to the persons who are vulnerable. So we look at the various communities, persons who are in low-lying areas. So we could actually address in terms of evacuation. So we could have a pre-plan ahead of time.
Okay.
We don't want to wait until the last minute before we say persons should move to higher grounds.
Okay. Thank you so much, Mark. Appreciate that. And Miss Teresita, do we still have you on the line?
Hi, sir.
Hi, good afternoon.
Afternoon.
And how have you been holding up the past few months?
I've been doing fine. I've been keeping my head above water.
Excellent. No pun intended, but yes, excellent. And so walk us through what you've been doing with the hazard management team.
Well, recently I was working on the hurricane tabletop exercise, which brought all of our cluster groups together, which would be our support services, human concerns, infrastructure, and emergency response. And what we did for the tabletop is identify certain scenarios that could potentially pop up and how COVID would play a role in that, and seeing how we would try and mitigate or develop a plan to combat that. Because what we don't want to happen is that we're caught off guard and we're not planning for both COVID and hurricane season, because as you can tell, COVID isn't going away right now. There's no vaccine, so we have to make sure that we have plans and procedures in place to address both, and that persons don't feel as though they'll be vulnerable to COVID if a hurricane does happen. And at the end of the day, we have to weigh what emergency is more of a threat. Will it be hurricane or COVID? And then that will kind of guide our operations as well as our actions.
I think we could do a whole show on just the various scenarios that you came up with during your tabletop planning scenarios, because at the end of the day, there's so many what ifs that can come when you're talking about two different national emergencies that are direct threat to welfare. Are you able to share any of the scenarios that you were working on and solutions that were put in place for them?
Well, our teams are still working on finalizing the procedures. The tabletop exercise was more to get a discussion going around these topics, to make sure that persons were aware or just bring their attention to specific scenarios that could potentially appear during the hurricane season. So it's looking at ensuring that we have backup testing, that storm surge won't affect our lab, and if it does, where can we go or where can we store our resources to ensure that we can continue testing afterwards. It's looking at ensuring we have enough PPEs inside of the shelters so that persons do go there and they don't have the correct PPE, that we're able to facilitate that, so that there isn't a spread of COVID within the community, or there aren't persons who will are anxious if persons come there without masks. It's looking at how we deal with certain emergency situations, such as relief distribution, trying to prevent crowding at relief distribution sites. So trying to see what type of measures that we can adapt from COVID and incorporate that into our hurricane planning, because we have seen that there are some, procedures that have worked during COVID that we could potentially continue on into our hurricane season if the need does arise.
Okay, I have two questions which I've just cropped up. With regards to testing people who are coming to the shelters, is that going to be going on? Or
I don't have a final answer to that, but we have been looking at the possibility of either putting measures in place pre-sheltering or post-sheltering, so before a person leaves. So it's still a discussion that we're kind of toiling with that right now. And we haven't gotten a definitive answer, but it is something that we're looking at to try and prevent anxiety within the community, as well as potential spread if for some reason a person was asymptomatic and did go to the shelter and now they develop symptoms or they start to show symptoms afterwards. So it is something that we've been looking at. As we do identify that it is a potential, it is a threat, and there is a potential for it to happen. So we're trying to cover all bases so that we ensure the safety of all persons.
Okay. And then the next question is, once you, because a lot of this is a work in progress situation, and the situation, you mentioned the scenarios evolving and the solutions to the scenarios evolving. Once you have ironed out the procedural plans and how NEOC and hazard management will move forward with the various solutions, will those be communicated out to the public? And if so, how and through what mediums?
Well, just like how we communicated with the onboarding of pet shelters, we place information on our Cayman Prepared website, as well as our HMCI website. So we will be using social media as well as radio to try and get the information out so that persons are aware of what protocols have been put in place prior to coming to the shelters, so that everyone is prepared, everyone has their resources, and they know what is expected of them before they enter a shelter.
That's great. Ms. D'Aristida, thank you. Folks, was there anything else you wanted to add from the hazard management standpoint on the social distancing, PPE within the shelters, or even the mitigation of storm surge threats? Or do we cover all our bases there? I think we've covered all of our bases.
Yeah, pretty much. I would just say what we're looking for the hurricane season. We're working on a phase 2 of our national emergency notification system, where we developed a mobile app where we can notify our residents in the event of a natural disaster or a particular significant emergency. So that is work in progress.
There is a work in progress on the mobile app. Okay. Grace, we look forward to hearing more information on that app once it comes out to the on the market. Mark, Leslie, Teresita, thank you so much for joining today's conversation. We do appreciate it. We're going to go to a quick commercial break right now. When we come back, we'll be meeting with the infrastructure team, Mr. John Japal, Mr. Ali Fayamo. Oh, Simon, are you still on the line? Hello, good afternoon, Simon. No, we did, unfortunately, lose Simon there just now. So on that note, we'll be back with more talk today right after this brief commercial break.
All residents are asked to stay at home unless you have permission to work, have to go to a medical facility, pharmacy, bank, or supermarket. If you must go out, remember to stay at least 6 feet from other persons who are not members of your household. This reduces the risk of transmission, whether or not a person with coronavirus is showing symptoms. Everyone must wear face masks or other face coverings while taking public transportation, inside buildings, or other public spaces. For more information and to view the new regulations in full, go to www.gov.ky/coronavirus.
The RCIPS, National Drug Council, and Radio Cayman are reminding you to stay home, refrain from social gatherings, and having parties during soft and hard curfew. Do your part. Limit alcohol consumption or stay sober. Do not undermine your immune system and health by misusing alcohol or any other substance. Remember, we are all in this together. Stay safe, stay home, stay alive, Cayman.
Are you finding that your young child is anxious? Coping with COVID-19 related stress can be harder for children as they have less experience of facing big challenges. Signs that your child may need emotional support can include frequent crying or irritation, toileting accidents or bedwetting, changes in sleeping habits and appetite, frequent arguing or fighting with others, and increased physical ailments such as unexplained illnesses. For free and confidential support, call the Mental Health Helpline weekdays from 9 a.m. to 5 p.m. at 1-800-534-MIND. That's 1-800-534-6463.
Social distancing is crucial for our community to get back to normal, And never before has communication been so crucial. Keeping in touch with family, friends, and up to date requires you to stay in touch. Green Turtle offers the solution for both. Download the Green Turtle app now. Top up yours or a loved one's phone with any mobile carrier in any destination in Cayman. Phones delivered to your home, and with the new rewards program, you can even redeem points towards a new phone and other products. Download the Green Turtle app today. Green Turtle is not only the future of mobile, but today it can help save a life. Hashtag Stay Home Cayman. Take a ride on the Green Turtle Express today. Download the Green Turtle app. The future of mobile, saving lives today.
The Ministry of Tourism is establishing a needs registry for displaced Caymanian tourism employees. This information will be used for review of necessary support for the tourism sector. Caymanian tourism employees are asked to complete the online registration form available at tourismregistration.ourcayman.ky. Sign up today to be included.
Water Authority offices remain closed, and the Authority will only be providing essential services at this time to ensure customers have water supply. Customers can still conduct business with the Authority electronically. If you need to pay a bill, you can do it online by visiting our website, waterauthority.ky, and clicking on the Pay My Bill button. You can also make a payment via your bank. Customers can also contact our customer service team by emailing info@waterauthority.ky. Customers in Cayman Brac who require trucked water can continue to make requests by calling 948-1403. For updates and important messages from the Water Authority, visit our website, waterauthority.ky, or our social media pages.
Listen to the general public.
Your thoughts are just a telephone call away. 1-800-534-8255.
What the public is saying.
Let your voice be heard. And now,
Radio Cayman's Talk Today.
And welcome back to Talk Today. In case you're just tuning in, I'm Raymond Singh, filling in for Mr. Sterling Dwayne Ebanks, and we are hosting our annual Hurricane Preparedness Panel today on Talk Today. And we've got back on the line Mr. Simon Boxhall from Hazard Management. Mr. Simon, how are you today?
Hi. There you are, Raymond. I'm fine. Thanks for having us on the show.
No, thank you.
Just quickly, before we get to the infrastructure, I would just like to we recognize there are a lot of people with financial hardship at the moment, people out of work. Nobody's going to be turned away from the shelters if you don't come with a mask or even non-perishable food. But obviously, we'd really appreciate it if you can, if you are able to, please bring that if you're coming to the shelter. Also, with the current situation with lack of really evacuation capacity, and we saw, I think, nearly 10,000 people leave the island prior to Hurricane Ivan. That's going to put additional pressure on the shelters with the social distancing in place as well. So, we are asking people if they can, if they have got family members, friends, anybody who's got a sort of strong house in an elevated location or even an office building, that they know somebody who might be able to allow them into an office building, would ask people, especially this year, to try to plan their sheltering as far in advance as they can and try to reach out to somebody. The PPE needs to be a part of everybody's emergency kit this year, and sanitizers and things like that. And, it's kind of a challenging, evolving landscape with COVID-19. But again, hurricanes remain our number one threat to life and property. So people need to still continue to take time thinking about it, planning for it, and hopefully it won't happen. But I just want to sign off there. I just thank you again for having us on the show, and just wishing Cayman and our residents a happy weekend and hopefully a safe hurricane season.
Thank you so much, Simon. We do appreciate that. And to remind our listeners of Simon's statement, while nobody will be turned away from any of our shelter facilities, given the state of affairs, as we're all well aware of it right now. Extra planning is necessary this year. A lot of personal responsibility on everyone, especially those with kids and our elderly, to make sure you are planning ahead for this year's season. On that note, we do have on the line Mr. Ali Fayamo, Communications Leader in the National Emergency Operations Center. Mr. Ali, good afternoon.
Hey, how are you?
We're good. How have you been holding up with the communication side over at NEOC?
We are doing pretty well.
Good.
I have to let you know, though, that I have the whole infrastructure team with me. We conferenced in before we called you, so I'll let them introduce themselves.
Thank you very much for that.
Sure. I guess I'll go first.
All right, you're first, whoever that is.
Yep, it's John Andrew Japal. How are you doing?
Hey, John, how are you, sir? All right, so we have John Japal, Ms. Ali Fayamo. Who else do we have on the line with us? Hello?
Well, we had Julia from our utilities sector, from the Water Authority.
Okay.
Julian Lewis from 911.
So we have Julia from Utilities. I believe we have Mr. Julian Lewis from Public Safety.
Yep, that's right. I'm here.
All right. And then Mr. Avalon Porter from the National Weather Service as well?
No, he's not with us right now.
Okay, well, so we're waiting for him to join us. So, Ali, well, thanks for organizing everyone together. It makes the call a little more streamlined. Ali, talk to us about I guess how things have been progressing with the National Emergency Operations Center, and then with regards to our infrastructure, our communication systems, and how resilient those are in the event that, well, it would never happen, but in the event that a hurricane were to come ashore.
Well, I'll let John Japal, who's the lead for our infrastructure cluster, address the general stuff, and then I can pick it up with respect to the communications bit. John?
Yeah, thanks, Ali. Raymond, just to give some, context, I am the infrastructure cluster manager, and I'm sure there's been a lot of talk about the structure of the whole NEOC on the previous calls today. So, yeah, we're one of the 4 clusters, the other 3 being emergency response, human concerns, and support services.
Yes.
So my role is to, pass information back and forth between the various EST chairs, Ali being the chair of communications and information technology, Julia being the chair of utilities, and then we also have, Mr. Sims, who's initial clearance and debris management. They couldn't be with us today, but that's okay. And then there's damage and economic assessment, which I used to be part of that team before taking up this role. So that is focused on preparing for any event beforehand and making sure we're resilient there, and then conducting the necessary damage and economic assessment exercises and stuff like that afterwards. So we don't have anyone from that group today, so I can speak about that more if needed. But to date, I think the NEOC has been operating very well. Obviously, it's been 80-odd days of dealing with the COVID-19 crisis, but everyone's gotten to know each other very well. It's become a pretty tight network, and it's working well. And I think we're pretty much quite well prepared going into the hurricane season. I know a few of the ESTs still have a few boxes to tick off of action points, and some equipment they need to get sorted and a couple of MOUs in place. But I think everything's going pretty smoothly so far, given the crisis that we're dealing with. So that's kind of infrastructure in a nutshell. So Ali, you can take it away and talk about the communication stuff.
Sure. On the communication side, it's really just about making sure that critical communications links, whether it's here on island or off island, are working, and that we have the ability to help a provider recover from an issue, whether it's a storm-related issue or, in the case of a pandemic, maybe a critical member of staff has fallen ill. So what can we do? Do we need to beg or borrow, a staff member from someplace else, or get some equipment shipped in, that kind of thing. So we collect, as we run the telco regulation side of OffReg, so we work with our telcos and the radio stations, FM stations, to make sure that their business continuity plans are up to date. And so we did that this year and asked them to update the pandemic response part of their plan. But of course, this thing has caught us all off guard. When I say all, I mean pretty much everybody on the planet. We're all writing new handbooks to address this. So it's been quite a learning experience for all of us, I think.
I guess if there's any silver lining to this situation is the ability for that to develop a well-oiled machine within your department leading into hurricane season. Now, with regards to our communication, our internet and our phone lines, with 17 years between Ivan, have we seen an upgrade in the resilience of our systems?
Yes. So on the mobile side, for example, there's a lot more connectivity off island and a lot better connectivity between the networks than there were a decade or so ago. We also have a lot more cell sites than we had during Ivan, and the technology has moved from what would have been 3G back then to 4G LTE right now. So you're able to do a hell of a lot more on your phones than you used to, but that means you're more reliant on that technology than ever before.
Sure.
So generally the capability of those networks and their interconnective nature has improved. On the internet side, it's just a matter of demand. The demand has gone up dramatically as everybody's more connected, but also doing lots more on the web, watching a lot more video, streaming services and other things than they used to. So that's driven up a lot of demand. And what has happened actually is that a number of cache servers have been installed in Cayman. So a lot of times when you're watching Netflix, for example, you're not actually getting that video served to you by a server in the States or someplace else. A lot of the providers here actually have their own Netflix cache servers in Cayman, so that it becomes a lot more a better experience for customers. So generally speaking, the networks have all improved in terms of capacity, quality, connectivity, and their general resilience is actually better as well. So all the telcos, for example, have circuits on both of the submarine cables that come into Cayman. So if they lose circuits on one, they can restore on the other cable.
That's, I always talk about wanting to learn something new every day, and you have just enlightened me on a few different elements of our telecoms infrastructure. Thank you, Ali. Is it Mr. Julian Lewis? Do we have you on the line still?
Yep, I'm here.
Mr. Julian, so walk us through the public safety communications element of your role.
So our primary role is going to be taking emergency and non-emergency calls through the 911 system. Especially during a storm and even during the pandemic, 911 is the place to contact. Everybody should know who to contact for emergency or immediate attention. And we're here. We're always here, 24 hours a day. So we've been prepared forever. We've never stopped. So preparing for a hurricane during this COVID time is just a simple bump in the road for us, looking at how do we handle the pandemic and the hurricane at the same time. So some of our internal personal plans have been kind of actioned already. I think it's always proper to say that our team is awesome. We have an exceptional team here. I'd like to say thanks to them for all that they do. I'm extremely grateful to be part of an awesome team like this. But we're ready. One of our primary roles is to ensure that the public safety radio system is always functional and the uptime is high. So what we're doing now in preparation for the season is testing the radios, doing a lot of site preparation, doing some early refresher training with people who haven't used the radios all year, and some external services to the comms links. But in general, my team is usually on high alert and ready.
You know, I will say, Julian, I think you should be a motivational coach. That entire segment was so uplifting. You're so proud of your team there. With regards to the emergency radio system that we heard in operation back with the earthquake a few months back, can you walk us through that system one more time?
So that system is it's a partnership between HMCI and ourselves. So there are different layers of authorization of how that system gets triggered. But at the base, at the root of it, it's a solution that's designed to alert the public when there's a storm, an imminent weather, or something to that effect. It's sort of difficult when there's sudden onset, but we're still going to have that opportunity to use it for something that's coming quickly. But it's a notification system that is initially set up now for radio interrupt, as you may have heard quite a few times over the last few months, and it's been tested, tried by most of the testers here, and it works. It's solid, tried and proven. We're moving into a phase 2, which I think you may have heard through HMCI. They're driving the train on a lot of that. It's hopefully going to be in place very, very soon, but we're doing extremely well from a technology standpoint. We're up there, get them 100 out of 100 for using the technology to help the community.
And so the radios, 2 questions then. At what point during the storm cycle, is it a tropical storm? Is it when we're 24 hours out? At what point will the emergency radio system kick into gear?
Well, that's basically a policy decision between HMCI and the hurricane executive. 911 and DPSC would be part of the squeezing the trigger for them. I'm not sure if there's an actual policy decision made on when we will use that system to advise the public on the hurricane.
Okay.
But there are other systems in place right now that do that. The radio, HMC has existing radio protocols, but the emergency alert system may have functionality there, and that's a decision that I think HMCI will have a key role in making.
Okay. And then the second question was in regards to what is phase 2 of the plan that you were just referencing? You had mentioned the phase 2 plan there. Are you able to walk us through a little bit more on what phase 2 is?
Well, phase 2 is using more of the social media, web-based alerts, getting information to the community and the public through their smartphones, and giving people a chance to opt into different levels of alerting. It's something that most of us would be aware of, may have had experience with, especially in going into the States and hearing about tornadoes and storms and getting a weather alert over your phone.
Okay, so we're looking at the dual system of the...
Give the community an opportunity to get more alerts.
Okay, so we're looking at the radio element was phase 1, and now the phase 2 being more of the smartphone contact. Okay, great. Thank you so much, Julian.
A lot more of the media channels and social.
Okay, thank you for that. And do we have Miss Julia on the line still? Hello. Good afternoon, Julia. Are you with us? Oh, it looks like we have lost Julia. Ali, are you able to step in and talk to us a bit about the water and utility side of the...
I will dare not tread on such dangerous ground. My lady has a PhD, and I am not going to stomp on that territory.
All right, so we have to wait for Julia to get back on the line there. John, is there anything else you want to add into this conversation here in regards to the planning and infrastructure side of it, either pre or post storm?
Sure. I mean, I can just sort of mention what we do to prepare, and I guess what happens after is it's a large team in that emergency support team. It comprises, as I said, the planning department, public works, the economics and statistics office, and they're dealing with all the data that's being collected by everyone else out in the fields, and then doing up the necessary reports and requests for aid from overseas if necessary, and that sort of thing. And then there's also, Department of Agriculture checking on, damage to the agricultural systems. There's Department of Environment checking on all their natural habitats and wetlands, stuff like that. NRA checking out the roads. So it's a big group of, I guess, who you would expect to be represented. But I mean, the gist of it is, we all get our plans in place for our individual agencies going into it. So planning, for instance, they get their teams together. They divide the island up into sections and assign teams to those sections. Make sure vehicles are scattered around. So if we lose a vehicle here, we can still have access over there. We get all the checklists and other equipment in place. There's a system in place for doing the damage assessments. There's forms, there's stickers that go on to the buildings after they've been assessed. We're moving to an electronic platform for that, which ties into Lands and Survey, because they have a very robust geographic information system that they feed out, where we can, we already have all the data in there as to blocks and parcels, buildings, utilities, so we can quickly feed information back from these damage assessments, provided that there's some connectivity. But as Ali said, we'll be good there. But I mean, these new apps and stuff, they can work offline, and then we can upload the data later. Obviously, we still have the paper forms and the old school way of doing things, but the idea is to get things done quicker, and to also, since we're working with so many different data sets, that we can combine them very quickly and generate reports pretty quickly and see who needs help.
Okay.
How to prioritize that, and stuff like that. So the idea is to prep and get all those things in place beforehand, and then
of course,
after we get the all clear, actually mobilize all those teams to go out and start conducting the assessments. And then when it gets back to ESO, they get the fun job of trying to quantify any loss.
Okay.
So that's kind of how it all works.
Thank you, John. I appreciate that. Was very in-depth. I appreciate that, the intel there. Ali, we had one question that just came in offline while John was there. With regards to the fiber optic lines that are running, what is the capabilities of those to withstand a strong storm?
Generally speaking, when submarine cables are landed anywhere in the world that you go to, the cables themselves, when they're way out in the deep water, are very small. I mean, we're talking smaller than the cables you see hanging from poles on the street, because it's glass fibers. It's real small, and glass fiber is immune to the high pressures of the deep water. But as the cables get closer to shore, they get armored. And by armored, I literally mean they are wrapped in sheaths of twisted braids of steel. So look at the power poles outside, and look at the CUC wires at the very top. They take wires like that and weave them around the cable, so it becomes very thick, very heavy, and very heavily armored to withstand things like boat anchors and propellers and adventurous tourists. So typically our cables, the two that we have that are in service right now, are actually buried before they approach the shore. So they'll withstand typical wind and rain and not rain, but wave action. During Hurricane Ivan, we had some of the cables being exposed, but nothing was broken because they're still heavily armored.
Still heavily armored. All right, thank you for that. Hopefully answer the caller's question there. Gentlemen, we do have to go to our headline news now. Thank you so much again for joining us today, and all the best with the rest of your planning.
Thanks, Ray.
Thank you all. All right, we'll be back with more talk today right after our 2 p.m. headline news.
Your 2 p.m. headlines brought to you by greenturtle.ky. Take a ride on the Green Turtle Express today. Download the Green Turtle app, the future of mobile, saving lives today.
Today's biggest news.
Radio Cayman.
It's only 2 species that we have here on Island.
Generations present. Your voice, your choice.
It is in the best interest of the people of these islands.
Local, regional, international. This is Headlines from Radio Cayman's newsroom.
Today's biggest news.
Join the National Trust team and Walk for Nature during June 12th through the 19th. Embrace the beauty of nature around you, whether that means walking near your home, walking around your neighborhood, or running your favorite training route. This is not a measured race. Be sure to look out for Iggy, the blue iguana mascot that might be walking in your neighborhood. Good afternoon once again. I'm Dion Anglin with your headlines and news elsewhere. China is facing mounting criticism over its plan to impose a security law in Hong Kong, which would make it a crime to undermine Beijing's authority in the territory. The US, UK, Australia, and Canada have condemned the legislation. U.S. President Donald Trump is expected to announce his response later today. China has rejected foreign criticism. And a couple who documented on a popular YouTube channel their life with an autistic toddler adopted from China are facing a backlash after they revealed he had been placed with another family. Mika Stoffer and her husband James, based in Ohio, produced videos about Huxley's adoption and his challenges. Since 2017, the couple received sponsorship deals and video revenue. While some understood the decision, critics accused the pair of exploiting Huxley to build their YouTube career. That's a wrap of your headlines. I'm Dion Anglin.
Social distancing is crucial for our community to get back to normal. And never before has communication been so crucial. Keeping in touch with family, friends, and up-to-date requires you to stay in touch. Green Turtle offers the solution for both. Download the Green Turtle app now. Top up yours or a loved one's phone with any mobile carrier in any destination in Cayman. Phones delivered to your home, and with the new rewards program, you can even redeem points towards a new phone and other products. Download the Green Turtle app today. Green Turtle is not only the future of mobile, but today it can help save a life. Hashtag Stay Home Cayman. Take a ride on the Green Turtle Express today. Download the Green Turtle app. The future of mobile, saving lives today.
For the latest in news and information,
follow Radio Cayman on social media, Facebook, Instagram, Twitter. Download the Radio Cayman app or log on to our website, radiocayman.gov.ky.
Your voice, your choice, your radio.
This is a public service announcement from your Radio Cayman, your community radio station. Here are some coronavirus prevention tips.
Home isolation means staying indoors and completely avoiding contact with other people. You need to do this if you have symptoms of COVID-19. If you are practicing home isolation, you should stay in a well-ventilated room with a window to outside that can be opened, separate from other people in your home. Keep the door closed and use a separate bathroom from the rest of the household, if available. If you have to share these facilities, regular sterilization will be required. Consider drawing up a bathroom schedule for washing or bathing and have the isolated person using the facilities last.
For the latest updates and information, please visit hsa.ky/public-health/coronavirus or gov.ky/coronavirus.
Dear students, we know that you miss your friends, being outside, and most of all, coming to school.
And we hope that you understand that everything happening right now is to keep you safe from harm.
You are our priority. You are the future. So even though this is a tough time, we believe in you to be the leaders we know you can be.
To stay focused on doing your best work even when no one is watching.
To be helpful and respectful to your parents and guardians at all times.
To be kind and thoughtful of everyone around you.
To always be thankful, even for the little things.
And most of all, to remember to keep in touch with us because
we are here for you. Love your teachers.
A message from the CIFEC, Clifton Hunter, Creek and Spot Bay, Georgetown, Prospect, Savannah, and Sir John A. Cumber Schools, and Little Cayman Education Services.
Has being quarantined at home have you looking at your living space differently? Well, Tomlinson Furniture is now offering free island-wide deliveries and phone consultations to help you design a comfortable living space. For inspiration and ideas, browse the Tomlinson Furniture and Mattress Gallery Facebook page, Tomlinson Furniture Cayman on Instagram, or website at tomlinsonfurniture.ky. Open from 9:30 a.m. for phone consultations and orders. Call 949-5383. Tomlinson Furniture and the Mattress Gallery. Free delivery island-wide.
We are currently in a soft curfew period in Grand Cayman until 8 o'clock tonight. Persons with surnames A to K are allowed to do banking and shopping on Mondays, Wednesdays, and Fridays, and those with surnames L through Z are allowed to do the same on Tuesdays, Thursdays, and Saturdays. Anyone caught breaking curfew is liable on conviction for a fine of $1,000 and to imprisonment for 6 months. For more information, go to www.gov.ky/coronavirus.
Social distancing is crucial for our community to get back to normal, and never before has communication been so crucial. Keeping in touch with family, friends, and up-to-date requires you to stay in touch. Green Turtle offers the solution for both. Download the Green Turtle app now. Top up yours or a loved one's phone with any mobile carrier in any destination in Cayman. Phones delivered to your home, and with the new rewards program, you can even redeem points towards a new phone and other products. Download the Green Turtle app today. Green Turtle is not only the future of mobile, but today it can help save a life. Hashtag Stay Home Cayman. Take a ride on the Green Turtle Express today. Download the Green Turtle app. The future of mobile, saving lives today.
Listen to the general public.
Your thoughts are just a telephone call away. 1-800-534-8255.
What the public is saying.
Let your voice be heard. And now,
Radio Cayman's Talk Today.
And welcome back to Talk Today. Our show's just coming to a close as we get ready for our 2-ish p.m. Press briefing coming up to provide us with the updates on the current state of COVID-19 here in the Cayman Islands. We have had a very full show today of guests as part of our annual hurricane preparedness show with members from the various clusters making up the National Emergency Operations Center. I guess a couple of review points that we do wish to remind listeners of, which were covered today. Your primary source for information, nothing new to the community, is caymanprepared.ky. Do take an opportunity, especially this year, following what we've seen as a very trying year between the earthquake early in the year, and just being notified that we'll be going to the press briefing here momentarily, so if you hear me cut off. I do want to thank all of our listeners here. Just getting the wave down again.
Joining us today.
Oh, and I'll send over back to Susan. The press briefing is beginning right now.
Welcome to our viewers joining us on CIGTV, YouTube, Facebook, and our listeners on Radio Cayman. Now, today's prayer comes as we get to the end of Child Month that we've celebrated this May, and it comes to us from Miss Leah Johnson.
Dear Lord, thank you for this day. Thank you for His Excellency the Governor, the Honorable Premier, Honorable Minister of Health. Lord, we ask that you continue to protect our governor and our country in these difficult times during COVID-19. Dear Lord, in Isaiah 41:10 says, your word says, fear not, for I am with thee. Be not dismayed, for I am thy God. I will strengthen thee, yea, I will help thee, yea, I will uphold thee with the right hand of my righteousness. Lord, we thank you for your word and promises, and trust that you will continue to lead and guide this country. In Jesus' name, amen.
Thank you, Leah. We're joined today by our panel, His Excellency the Governor, the Honourable Premier, the Honourable Minister for Health, And in the room with us, we have the Chief Medical Officer, the Police Commissioner, and our sign language interpreter, along with the Director of Hazard Management, Cayman Islands. Welcome to members of the media joining us on Zoom, and we also have the the Medical Officer of Health joining us also via Zoom. So we'll turn first to Dr. Lee.
Good afternoon. As you know, we've been focusing on trying to screen certain sectors of the population in order for us to get a feel for the rates of infection in the working population that are going back to work. And we have got through around 15% of construction. I've actually had a whole shed load of results that I received about an hour ago, so this figure that I'm about to give you doesn't include that. But so far we've screened around 15% of the construction group that have gone back to work, and we anticipate that group to be around 8,000 people. Of those, we've had around 6 of them come back as positive with COVID-19 disease, or the test for COVID-19 disease, and which is a rate of around 0.5%. Since we started the mass screening program 5 weeks ago, our highest percentage was 1.1% of the number of people testing positive, and the average of that has been 0.5%. So actually the construction workers are bang smack in the middle of that average percentage. As you know, the HSA has been having a maintenance day today, but for some reason they've excelled themselves and actually have produced 496 results despite the maintenance day. Some of those have come in last night and some have come in this morning. The Doctors Hospital have also produced 177 results, and that totals 673 added results today, of which one is a positive, and that positive is presumed to be a community acquired. And as with all the results we've reported since the 27th of April, that was somebody who was asymptomatic who presented for screening. That brings our total positive to 141, with 3 remaining in Cayman Brac positive, which are obviously historical positives. I just want to dwell a little bit on Cayman Brac. They've continued their screening program in Cayman Brac and have currently swabbed 818 people in all of the population of some 2,000. So they're going to hit their target of having screened 50% of their population probably middle to end of next week. Of those 818, 699 have received their results or have had the results produced and will be receiving them imminently. As we know, there are 3 positives amongst those 699. There's also some good news for Cayman Brac and good news for the Cayman Islands. The Foreign and Commonwealth Office have been trying to procure machines to further increase our capacity to test for this disease, and they have sent machines called Gene Expert machines made by a manufacturer called Kefid to a number of the UK overseas territories. The Gene Expert machine has arrived on Cayman and has just been picked up this morning. This machine is different to our current real-time PCR machines, as it's more like, you might think, a Keurig or an espresso coffee machine. You pick the cartridge that you want, and in this case we've got 200 cartridges that we're going to test for the COVID disease. You pick the cartridge, you put the sample into the cartridge, and then the result comes out about half an hour to 45 minutes later. So it's a much simpler technique in order to find a result, and much quicker. As I mentioned, this Gene Expert machine has holes for 4 cartridges at once. So it's not as capable of turning out the volumes that are the other systems we have on the island. It's anticipated that once the Health Service Authority are used to the machine, that it's gone through its checks and everybody is comfortable with how it's used and everybody is trained in how it's used, it's anticipated that that machine will go to Cayman Brac in order to help Cayman Brac be more independent, particularly with the hurricane season upon us starting on Monday. If either of the airports were unfortunately to be cut off at any time, it would leave them a little bit more independent from some of the medical needs, especially around the time of COVID, in order to help manage the population on the sister island. So that's really good news for Cayman Brac. That machine has been given to us by the Foreign and Commonwealth Office, along with 200 of the almost like a starter packs for us to start to test for SARS-CoV-2. Just to go on through the figures, so we currently have 1 symptomatic person, 71 asymptomatic. We remain with nobody admitted with COVID-19, and 68 have recovered. Thank you.
Thank you, Dr. Lee. Just quickly before I turn to, we'll go first to Kayla Young at the Cayman campus. The new kit that you mentioned, is that already on island or it's on its way?
Yes, that arrived, was picked up from customs late this morning. So it'll take a bit of time for them to get used to how to use it. But
And that was going to be my next question. Does it require any special training in order to use?
it does. I mean, all new equipment requires a little bit of special training, but it's much less specialist, which is the beauty of it. It's much more something that any laboratory could take on. It doesn't need the particular sets of skills that you need to use a PCR machine, as I understand it. I stand to be corrected, but that's what I understand. It's much easier to use.
Great, thank you. Kayla, go ahead with your question for Dr. Lee.
Hi, Dr. Lee.
Hi.
I wanted to get some more information about the Gene Expert machine that you just mentioned. Is there any difference in how testing is carried out with this type of machine? Is there any difference in the accuracy level of the results that it produces?
No, this is the same scientific basis of polymerase chain reaction as the other polymerase chain reaction machines that we have. It's done in a much more kit form, so that you can't. The results come out when you put the kit in. It's specific for the disease you're looking for. The like cartridge that you put in is specific for the disease you're looking for. But then you can get different cartridges for different diseases. So you can get a dengue cartridge, for example, or an influenza cartridge that you could put in and check a sample for that. I think that's basically it. It's a much easier way of being able to test, but you can't put the volumes through it like you can through the other labs, which can take, result 50 or 100 people at a time.
So will this change the number of tests that we are able to complete in a day?
I mean, it'll change it a little bit. I think what's far more important is the fact that if we have urgent samples, and we have a lot of urgent samples, like let's say we need to air ambulance somebody off, or we want to transfer them from one hospital to another, or there's pressure on space and you need to know whether you can release somebody from one part of the hospital to another part of the hospital, those sorts of, or at a diagnostic level, those sorts of decisions and results can be available much faster.
Great. And you said that a machine will be going to the BRAC. Will this be the machine provided by the FCO or the PCR machine that's currently in use?
No, it'll be the BRAC's laboratory facilities are fairly sophisticated for a small island, so they can remain independent. This is going to add to their armamentarium, and this will be a Gene Expert machine. So we wouldn't be sending one of the bigger PCR machines there. That wouldn't really work, as you don't need to send somebody with particular technical expertise there, which is not required for them.
Great. And we've seen a bit of a change in the breakdown between men versus women who have tested positive for COVID. Is this an influence of testing more construction workers? And do we see any kind of difference from observing cases here internationally in how men versus women are reacting to the disease?
Yeah, you're absolutely right. Because we've been screening working population, you're actually looking at, you're probably more representative of the demographics of who you're looking at, rather than the nature of the people, as everybody's coming forward with relatively few symptoms. And also, equally, that working population group are much less likely to have chronic diseases, although some will, obviously, but much less likely to. I think I shared the other day as well that the age range of the people who have tested positive is also a very narrow range. It's between 20 and 60, and there's a peak around 30 to 40, so it is a much younger group. As far as the experience of COVID, as the disease is concerned, as people experiencing symptoms, not sure we've had enough of patients of that to look to see where we're comparable. We're lucky in that we haven't had enough, in that we haven't had that much disease on the island.
Thank you, Doctor. That's all for me.
Thank you, Kayla. CNS, Wendy Ledger. Wendy.
Thanks, Caroline. Good afternoon, Dr. Lee. Just
Hello
a very
again.
quick sort of housekeeping question, actually. Can you tell us when people who are in quarantine first start getting tested? Is it after the full 14 days or before that?
I think you're talking about the people who are put in isolation who've travelled. Is that right?
Yeah, that's right. They've got government quarantine facilities. So
the first test will be done after they've spent 14 full days in quarantine.
Okay.
Of course, if that timing of that happens, if that 14 days ends at 6 p.m. on a day, they're not going to be tested until the next day. I don't think that would be reasonable. So.
Okay, so they serve the full they go there for the full 14 days. Then they have their first test. And if that test is positive, they continue to stay there until they produce 2 negatives. Is that correct?
That's correct, yes.
So when you're tested for the first time after 14 days and it's negative, how long do they wait before they have to be tested again?
If they have a negative test after they've been isolated for travel, then they're free to go after that.
Okay, great. That's all I wanted to do was just clarify that. Thank you very much. I appreciate it. That's all I have for Dr. Lee today.
Great, thank you, Media. Thank you, Dr. Lee. We'll turn next to Commissioner Byrne.
Good afternoon. The crime situation across Cayman Islands remains very stable and the policing and security operating environment is very calm. The hard curfew in Grand Cayman and Cayman Brac continues to operate well. Social distancing at commercial and business outlets is going well, and most businesses visited by our officers have introduced signage and guides for social distancing, and patrons and customers are reported to be understanding and compliant. We have received a number of reports where persons are promoting house parties and inviting friends over for drinks and meals. Some of these events are captured on social media, others are notified in the forms of complaints received from members of the community. To remind community, this is not permitted under the regulations, and a small number of persons have been warned for prosecution. These social gatherings breach both soft and hard curfew provisions. I previously mentioned that speeding was a major community concern, and we have, of course, seen an increased amount of traffic on our roads. And just over the past 2 weeks, 404 motorists were issued with speeding tickets between the 15th and the 29th of May, top speed 102 miles per hour. So I think there's no need to remind community listeners and the public that speeding is a big contributor to serious and fatal accidents. We must slow down on our roads to prevent fatalities and serious injuries. To give a rundown on where we are with the prosecutions or the warnings for intended prosecution under the curfew regulations, to date from the 23rd of March, we have had about 780 persons warned for prosecution for breach of hard curfew or soft curfew regulations. And of interest in that, 17 persons have been warned for prosecution more than once. This includes 2 persons who have been warned on 3 separate occasions and one person warned on 4 separate occasions. 53% of the persons warned for prosecution were pedestrians or on bicycles, and 47% were in vehicles. And since the start of COVID restrictions, 42% of all warnings for prosecution have been in Georgetown, 32% in West Bay, 11% on Cayman Brac, 11% in Bodden Town, 3% in East End, and 1% in Northside. In the last 14 days, there have been 35 incidents resulting in warnings for prosecution being issued against 51 persons. And these incidents were in West Bay 18, Georgetown 12, Bodden Town 3, East End 1, and Cayman Brac 1. Just a very quick snapshot of where we are with crime. Overall crime, excluding COVID incidents, has reduced by 33% compared to the same period for 2019. Violent crime has reduced by 25% compared to the same period for 2019. Burglary has reduced by 63% compared to the same period in 2019. Robbery has reduced by 89% compared to the same period for 2019. And theft has reduced by 62% compared to the same period in 2019. So it just gives you a snapshot of where we are and the impact of curfew and both the soft and the hard curfew regulations. If I could now, well, otherwise all is stable and calm across the islands, but if I could take a few moments to go through changes in shelter-in-place and hard curfew changes which will come into effect next Monday, the 1st of June 2020. And just to run through them insofar as they impact on policing operations and to provide the legal framework, this morning, the 29th of May 2020, as required under the provisions of Section 49 of the Police Law 2017 revision, I consulted with His Excellency the Governor of the Cayman Islands and advised him of the necessity to impose a new curfew order commencing on the evening of the 1st of June 2020. My advice to His Excellency was predicated on the basis that it appears to me that having regard to the immediate threat of a serious hazard on Grand Cayman and Cayman Brac in the Cayman Islands associated with COVID-19 virus, that there are reasonable grounds to believe that in the interests of public safety, it is necessary to impose a new curfew order. This morning, following a meeting of the National Hazard Management Executive, followed by a meeting of Cabinet, I have now received permission from His Excellency the Governor to impose a new curfew order effective Monday, the 1st of June 2020. And in that permission, it has been approved that this new imposition of curfew order will be in place for a period of 21 days and will end on the morning of the 22nd of June and will be subject to the following conditions. Curfew period will run nightly between the hours of 8 p.m. and 4:30 a.m. for the period Sunday night, the 1st of June 2020 until 4:30 a.m. on Sunday morning, the 7th of June 2020. On the night of the 7th of June 2020, Sunday, adjustments will be made for the hard curfew period to run nightly from 10 p.m. until 4:30 a.m., concluding on Monday morning, the 22nd of June 2020. The new imposition of curfew order relates to Grand Cayman and Cayman Brac only. And just to explain it a little, this weekend, the existing imposition of curfew order remains in place, with nightly hard curfew between the hours of 8 p.m. and 5 p.m. That is tonight, tomorrow night, Saturday and Sunday night on Grand Cayman and Cayman Brac. For Grand Cayman, a 2-hour exercise period is permitted tomorrow and Sunday between the hours of 5:15 a.m. and 7 p.m. on both dates. Beach access is permitted tomorrow, Saturday, subject to the alphabet surname restrictions, permitting surname range L to Z only. Beach access, fishing or marine activity is not permitted this coming Sunday, the 31st of May 2020. Moving to Monday, the 1st of June 2020, new regulations titled the Prevention, Control and Suppression of COVID-19, Partial Lifting of Restrictions Regulations 2020 will come into effect. These new regulations will be gazetted later this evening, and the key dates contained in the new regulations are Monday, the 1st of June and Sunday, the 7th of June 2020. The new regulations will significantly ease shelter-in-place our soft curfew restrictions, and the Premier will address you shortly on the range of easing of restrictions contained in the new regulations. And I will now outline the changes in hard curfew hours and the easing of restrictions that will apply. And if I could deal with Cayman Brac first. Soft curfew or shelter-in-place regulations contained in SL 42/2020, dated the 30th of April, which came into effect on the 4th of May, will remain in place over this weekend until Monday morning, the 1st of June at 4:30 a.m. This means that the existing imposition of curfew order, the nightly hard curfew, remains in place this weekend, tonight, tomorrow, Saturday and Sunday, between the hours of 8 p.m. and 5 a.m. and ends on Monday morning next, the 1st of June at 4:30 a.m., which is a very slight adjustment of 30 minutes from 5 a.m. back to 4:30 a.m. During this period of curfew, only exempted essential services personnel may be on the road, outside and away from the residence. On Monday evening, the 1st of June 2020, the nightly curfew period will be adjusted slightly, introducing a nightly curfew between the hours of 8 p.m. and 4:30 a.m. morning, which will run through until Sunday, the 7th of June 2020. And then on Sunday, the 7th of June 2020, nighttime curfew will be further adjusted to run nightly between the hours of 10 p.m. and 4:30 a.m., running through until Monday morning, the 22nd of June 2020. Looking at Grand Cayman, it's very similar to Cayman Brac, but just for clarity, I'll go through it. The current soft curfew or shelter-in-place regulations contained in SL 47/2020, dated the 16th of May 2020, which came into effect on the 19th of May 2020, will remain in place until Monday morning, the 1st of June at 4:30 a.m. This means that the existing imposition of curfew order, the nightly hard curfew, remains in place this weekend, tonight, tomorrow, Saturday and Sunday, between the hours of 8 p.m. and 5 a.m., ending next Monday morning, the 1st of June 2020 at 4:30 a.m., which again is a slight adjustment backwards of 30 minutes. During this period of curfew, only exempted essential services personnel may be on the road, outside and away from their residence. On Monday evening next, the 1st of June 2020, the night curfew period will be adjusted slightly, introducing a night curfew between the hours of 8 p.m. and 4:30 a.m., running through until Sunday morning, the 7th of June 2020. Effective Sunday night, the 7th of June 2020, nighttime curfew will be further adjusted to run each night between the hours of 10 p.m. and 4:30 a.m., running through until Tuesday morning, the 22nd of June 2020. And from a policing perspective, the key changes to curfew from Sunday, the 7th of June are: nighttime curfew is between the hours of 10 p.m. and 4:30 a.m. each night, Monday to Sunday included, on Grand Cayman and Cayman Brac. On Sunday, the 7th of June, and each of the following Sundays within the period of curfew, that is Sunday the 14th of June and Sunday the 21st of June, beach access is permitted between the hours of 5:15 a.m. and 9 p.m., subject to the alphabet surname restrictions Monday to Saturday, with no restriction on beach exercise on Sunday. Sunbathing, parties, picnics or congregating on public beaches is not permitted, and access to public beaches on Cayman Brac is already permitted by previous regulation. Exercise is permitted for 2 hours each day between the hours of 5:15 a.m. and 9 p.m. Exercise includes walking exercise on the beach and swimming in the seawater, and also includes fishing from the shoreline and iron shore. Changes to take place to deliveries. They are permitted until 11 p.m. food deliveries, collections of food until 9 p.m. curbside takeaway or drive-through, and all activities are subject to physical distancing or social distancing requirements set out in the new regulations. To assist in understanding this easing of restriction, exercise is confined to a period of 2 hours, and exercise includes swimming and fishing from the shoreline, includes iron shore. Social distancing requirements apply, and persons should not congregate in groups of more than 6. No other inshore activities are permitted. No picnics or other social gatherings are permitted on public beaches. And just to look at boating and fishing, the restriction on the use of boats for fishing and leisure has been relaxed, and permits fishing and leisure boating between the hours of 5:15 a.m. and 9 p.m. each day of the week, including Sunday. Inter-island travel by boat for leisure, for leisure and fishing is not permitted, and is subject to the restrictions that no more than 6 persons may be on a boat, and compliance with physical and social distancing protocols. And just to highlight, as in the previous regulations, no fishing or boating or congregating are permitted at the following locations: Stingray City, Starfish Point, Rum Point and Sandbar. This means that a person may not anchor any boat, exercise on the beach, fish or swim, or carry out any activities in any of these mentioned locations. This restriction does not impact beachside residents exercising at those locations. Apologies that took a little longer than would have liked, but thank you.
Thank you, Commissioner. I know we have some questions for you. Kayla at the Compass, first of all.
Hi, Commissioner.
Kayla.
I see that you're reading the restrictions from a written statement. Will the hard curfew regulations be released or a copy distributed to the media for clarity?
I'm looking at that at the moment, so a decision will be made next week, yeah.
on whether or not to release a written copy of the hard curfew regulations?
The hard curfew orders, which are made under Section 49.1, yeah.
Okay, great. And I wanted to clarify on when the new exercise restrictions will start. When can we start the 5:15 to 9 p.m. schedule?
That starts on Sunday, the 7th of June.
Great. And Sundays, anyone will be able to exercise on the beach?
Yes.
Have there been any issues with beach access so far? Any problems with people abusing or crowding?
No, reports from a helicopter and our ATV patrols is that it's all going pretty well. I think there's been 2 detections over the last 2 weeks of breach of the soft curfew regulations.
Okay, great. And you listed some interesting crime stats that we see that crime is down in many ways. Do you have any update on the domestic violence situation? I believe last time we spoke, you said that cases were down.
Yeah, still no spike. I mean, there are a lot of incidents coming into us of situations occurring in the home. We are looking at it, but there has been no spike in domestic violence. Some of them are civil disputes that we're called to, but definitively no spike in domestic violence incidents at the moment. I will be releasing a crime report next week, and reference will be made to domestic violence figures.
Okay, thank you. That's all of my questions for you.
Thank you, Kayla. Wendy.
Thanks, Caroline. Good afternoon, Commissioner. How are you?
Wendy, good, thank you.
Can I just ask you to explain why a decision was made to impose a 21-day curfew that's going to change in a week? If you get what I mean, and why you haven't decided to just take it week by week to see how things change, as it were, rather than making the decisions from this point for 3 weeks out. If you could just explain the thinking by why we've imposed the curfew this way, this time.
So it's a phased relaxation of regulations, and we are still very much in the prevent, control and suppression stage of the virus. I think that's to the forefront of all decision making in terms of what we're doing to protect communities and save lives. So it's very important that it's done in a controlled manner. I'm sure the Governor and the Premier will say more about it, but from where I stand, or from the RCIPS side, and looking at it from the enforcement side, we're still very much in that prevention, control and suppression stage of it, and it needs to be done in a very controlled and phased way. And I think that's all perfectly reasonable in the circumstances and the environment in which we're operating.
Okay. Can I also get some clarification on Sunday? I don't know whether this would be a question later for the panel, but I understand at the moment, in theory, if a shop was open on Sunday, none of us could go anyway because there isn't an alphabet split. So if you wanted to go to the gas station on a Sunday now, how does that happen?
Okay, so that's an anomaly in the law. We have discussed it. It is addressed in the new regulations. So currently on this Sunday and the previous 2 Sundays, you have the Sunday trading law and orders made under the Sunday trading law, which allowed those gas stations and mini-marts under 4,000 square feet to open for business. But the regulations only permitted the alphabet range to shop Monday to Saturday and precluded Sunday. This has now been addressed in the new regulations, which come into effect on Monday next, and it won't be an issue on the following 2 Sundays after that.
Okay, thank you. That's my questions. Thanks, Caroline.
Thanks, Wendy. We have some from the Caymanian Times as well. Ralph.
Yes, good afternoon, Commissioner, and welcome back. Can you speak to the morale of your team? They've been doing some extended hours. Can you say how they're holding up under these circumstances?
Yeah, absolutely great. The team have been fantastic. And again, when I talk about the team, I talk about our CBC, work officers, special constabulary, and of course our permanent officers, and I include my civilian support staff. They have been incredible in their approach to work, working long hours, commitment, and they remain completely committed to the task of enforcing the regulations. We are extremely pleased with the way it's going. And I did mention earlier on at the start of it, we had introduced a new roster to provide 4 days on, 4 days off for plenty of downtime, and officers do work overtime in the middle 2 days. So rest certainly incorporated into it. Everything going extremely well. Morale is very high.
Great. And so you have enough officers to continue with the task ahead?
Yeah, we're doing very well. No shortage of officers at the moment. We're doing extremely well, yeah.
One final question. Have you gotten any challenges with dealing with the public who are breaking those laws or those curfews?
No, we had an incident last week where one of our officers was attacked with a machete. We dealt with that, and that's about. Most people are, as I said, understanding and compliant. You approach them, you tell them that they're in breach, and there's either a ticket issued or they're warned for prosecution, one or the other.
Okay. So Cayman Islands is a good place to be.
It is.
Thank you.
It is, yeah.
That's all for me.
Thank you.
Thank you.
Thank you, Ralph. Thank you, Commissioner. Now I know we'll all want to hear next from members of the panel. Premier.
Thank you, Carlin. Hello, everyone. Happy Friday. Today we are at another significant milestone. We've passed 11,000 test results, and we maintain our efforts to respond to the COVID-19 pandemic while moving closer to the recovery and rebuilding stage of the economy. Our testing results continue to indicate that whilst the virus is still very much amongst us, because of your efforts and sacrifices, we have so far been winning the fight against it. Because of the efforts of all the people of these islands, we are able to slowly emerge from our homes and to move about and feel safer in doing so. We have all sacrificed, from the eldest to the very young, and it has been hard. I know it has been hard, and it continues to be hard. But now there is more than just hope. There is the promise of a soon coming day when life can go back to some real semblance of normalcy. We are currently operating at suppression level 3. At this suppression level, the mission has been to get our society and economy moving safely by allowing outdoor recreation and economic activity to resume. It is widely known that the COVID-19 virus spreads most easily in enclosed environments, and therefore this increases the rate of transmission. And this realization has guided and continues to guide the decisions made at this level. And this is why indoor venues, including places of worship and school buildings, remain closed at this time, with church services and classroom teaching still happening online. As a country, we have a lot to be thankful for as we approach an enviable position of being able to relax restrictions with no hospital admissions and no further loss of life other than the one unfortunate gentleman who we refer to as patient 0. It has always been our primary goal to save lives, and we will continue to approach our treatment of this pandemic with this as a priority. So I come back to hope and promise. As I've said from the beginning, we must preserve life and health and then look to rebuild. I will forever remember the many messages of support for what we were doing and are doing, and the many messages that showed me clearly that our people never lost hope. To paraphrase the late, great Martin Luther King Jr., there are times when as a people we must accept finite disappointment, but we never lose our infinite hope. It is that spirit of hope and the strength of our islands and of our people, all of our people, which has brought us thus far and will pull us through. This is why today I am pleased to announce an expansion of allowed activities within the current Level 3 moderate suppression phase, which will allow for more outdoor recreational opportunities, limited gatherings with friends and loved ones in public places, carefully managed additional economic activity such as outdoor dining and other business, which will safely help our country reunite and get back to work. That said, our private homes have been and should continue to be the safest place for us to be, and so gatherings in or visits to other households are still not permitted. Alongside the careful reopening of the country, while maintaining physical distancing requirements and other measures to keep us safe, we will also continue our testing, and we will continue to carefully monitor the spread of the virus in the community to ensure that community transmission continues to be low. All of us, however, have a part to play in this, and we must remain vigilant and continue to keep ourselves and others safe by practicing physical distancing, maintaining face and hand hygiene, and carefully considering if and when to participate in optional activities outside the home. We cannot yet become complacent. The virus is still amongst us. If we continue to have the success we are experiencing in suppressing the virus, then the plan is for us to move to level 2 low suppression on the 22nd of June, which will then see a further easing of restrictions. As I said before, we are continuing to test aggressively, and we hope to reach a critical threshold of 25% of our population being tested in the next 3 weeks. We are currently at around 16%. We anticipate that at level 2 low suppression, the risk of the virus being spread will be low enough that there will be an unlocking of high interaction and high touch businesses and services, a gradual increase in public gatherings, and perhaps most significantly, the return of external childcare to the home. I'm sure this will come to the relief of many parents and guardians who have been working at home while homeschooling. I am sure many children will also be very excited to see their nannies and helpers again. Also in level 2 low suppression, as I said, which we hope to get to on the 22nd of June, we can also look forward to the possibility of changing our everyday environment by supporting our domestic tourism industry with staycations. Over the next few weeks, these and other activities will be reviewed to ensure that when the public health situation permits, we will be ready and able to move forward. And so with that, I want to spend a little time going through what the changes are over the 2 stages of the 21-day period that the Commissioner described very well. So there are 2 parts to this, really. One is the bits that involve the unlocking of economic activity, and the other is the easing of restrictions with respect to social activities and exercise. Starting with the economic activity. From Monday, 1st of June 2020, all construction businesses may fully operate. Construction and related businesses, subject to any conditions which may be imposed by the competent authority, and of course, as always, all employees observing and other people observing the social distancing requirements. All retail and real estate businesses will be able to fully operate. Again, all must observe the social distancing requirements and enforce the wearing of masks by customers. On the social exercise side, persons will be able to exercise in any public place, including government walking tracks, which will reopen. Also, persons will be able to engage in open-air, non-contact sports. So that still means no football and the like. Non-contact sports such as tennis and golfing. But no more than 2 at any time may engage in such sport, and this will be subject to any conditions which may be imposed by the competent authority, as well as persons observing the social distance requirements. So these provisions that I've just referred to will apply from Monday 1st of June to Sunday 7th of June. Persons will be able to travel to convenience stores, mini-marts, or gas or refilling stations on a Sunday. However, the surname restrictions will not apply to these Sunday visits. This is with respect to the 7th of June, not, and going forward, not this coming Sunday. It should be noted that in Grand Cayman, notwithstanding the gradual opening of more businesses, those businesses which are not exempted or specified in the regulations shall remain closed. However, where possible, their staff can continue to work remotely from home. This relates principally to persons involved in the financial services industry. Travel between the islands continues to be subject to the same restrictions as before. There is, however, a minor change in that persons who provide security services between the islands will now be classified as providing essential services for the purpose of travel between the islands. The changes will take effect on the 7th of June. From Sunday, 7th of June 2020, hard curfew will be from 10 p.m. to 4:30 a.m., as the Commissioner has explained. The definition of public meeting in the regulations will change in Grand Cayman, and gatherings of up to 6 persons will be permitted. The current limit is 2, and that will remain the case, the current limit, until Sunday the 7th. In Cayman Brac, there has been no change, and 25 persons or less will continue to be able to take part in the said activities. The social distancing requirements will continue to apply. This does not apply to Little Cayman, which has no such restrictions. However, social distancing requirements and the wearing of masks indoor in public places where you cannot distance yourself appropriately continues to apply to Little Cayman. From 7th of June 2020, in Grand Cayman and Cayman Brac, restaurants and bars will be able to serve customers on any patio or other outdoor area which forms a part of the premises of the bar or restaurant. However, the following conditions will apply. 1, no more than 6 customers at a table, and unless these customers all come from the same household, social distancing requirements must be observed. 2, each table must be at least 8 feet apart. 3, no person shall be seated or served at an indoor counter in a bar or restaurant. And 4, any other conditions which may be imposed by the competent authority. Further, restaurants and bars will be able to open for such services until 9 p.m. Therefore, persons who travel to restaurants or bars to collect their food or to dine outdoors now have until 10 p.m. or will then have until 10 p.m. to return to their homes. The restaurants can continue with delivery of food until 11 p.m., which will be 1 hour later. Also, from the 7th of June, persons employed by businesses other than restaurants will be able to deliver until 11 p.m. In relation to exercise, a person will be able on or after the 7th of June to exercise with 5 other persons who are not members of the person's household for no more than 2 hours per day between the hours of 4:45 a.m. and 9 p.m. That is because the curfew has been adjusted backwards to 4:30 instead of the 5 that is currently the case. Also, persons will be able to exercise on a beach, swim in the sea, and fish from the shoreline on any day. Persons must, however, continue to observe the social distancing requirements when exercising outside of members of their own household. On or after the 7th of June in Grand Cayman, a person may use a boat between the hours of 4:45 a.m. and 9 p.m. on any day only for the purpose of fishing in the waters, subject to the following conditions. No more than 6 persons shall be on a boat. No person shall travel for pleasure between the islands to visit Cayman Brac or Little Cayman. And a person may operate or maneuver a boat so as to congregate, no person may operate or maneuver a boat so as to congregate or gather with any other person or any other boat or vessel, provided that the number of persons sorry, can I start that over? Forget what I just said about the last one. A person may operate or maneuver a boat so as to congregate or gather with any other person or any other boat or vessel, provided that the number of persons gathering does not exceed 6 persons. The current arrangement is only 2, so that number has increased to 6 who can be in a boat. So if there are only 2 or 3 in one boat, they can meet up with another boat that has 2 or 3 persons on board. The prohibition on boating activity in certain areas will continue. Thus, persons are still not permitted to congregate or have boats remain in Starfish Point, Rum Point, Sandbar, or Stingray City. In Cayman Brac, on or after the 7th of June 2020, a person may, on any day, continue to use a boat to travel for pleasure, including for fishing in the waters, and will be permitted to have 6 persons on board at any one time. The regulations will last until the 22nd of June 2020, or until such later date as the Cabinet may specify. So to pick up on the question that Wendy asked, which the Commissioner referred to, the hard curfew and the shelter-in-place regulations have and continue to work in conjunction with each other to support the overall premise, which is the continued lowering of the risk of transmission, community transmission of the virus. And the reason why the hard curfew is still considered to be necessary is that the public health advice that we have is still that it remains at this stage still very risky to have situations which encourage partying and the excessive consumption of alcohol and people mixing amongst each other, as is normally the case when you have parties. And thus, until we arrive at the place where the risk of community transmission of the virus is considered to be very low, it is felt that the hard curfew is still necessary, and that late night partying is still to be prevented. As I've indicated, on the present trajectory, we hope that we will get there where we don't need a curfew by the 22nd of June. Nothing that we are seeing, nothing that we are hearing gives us any worry or concern that the present suppression efforts, or I should say that the present results will reverse, or the trend will reverse and start giving us significant numbers of positives or clusters. So if we are right about that and the current trend holds, we should be in a position where I and many others can get a haircut round about the 22nd. I think in the meantime, I'm going to have to start wearing a cap to these press conferences. So don't mind if you see me with one.
Thank you very much. I can lend you my clippers, Premier. This is indeed a significant moment in our response to the crisis, and I very much welcome the measures, the relaxation of the measures announced by the Premier today. And I do believe these are very sensible, very prudent, and very measured when considering the risks that we face, and drawn up in full consultation an agreement with our Chief Medical Officer. But I do hope that these relaxations give everybody on the islands a lift, because I think restaurants and bars being open outside from the 7th is clearly a major step forward, all retail being open, and the restrictions, most of the restrictions on the beaches being lifted as well. So I just want to say thank you to everybody for all of your cooperation, because it's what you have done that has helped us to get to this moment. We are, of course, significantly increasing the likelihood of human interaction with the relaxation of these measures. So we do need to monitor the results. I do, again, urge everybody to pay so much close attention to the need for social distancing, basic hygiene, wearing masks in public places as we have more and more human interaction as we relax the measures. That is incredibly important for us to be able to manage the risk as we move forward. And as the Premier has said as well, I hope very much this is the last time we have to impose a hard curfew. It depends on the results, but we will hope to be able to move to suppression level 2 from suppression level 3, which would mean we could lift the hard curfew if things go the way we hope they do. Just on evacuation flights, I'm very pleased to confirm that the flight to London Heathrow is now confirmed for Friday the 12th of June. If you have registered with the travel helpline, you will be sent an email on Monday with details of how to book. So please do not call or email the travel helpline if you have already registered, they do not have any further detail. We do not have any further details about this flight at the moment, or the helpline don't have any further details about this flight at the moment. We will be bringing back a limited number of passengers from London to Cayman on the BA flight. But because capacity is limited at the isolation facility, seats on the flight will be allocated by the Cayman Islands London office. So do not contact the travel helpline for that. They will be in touch with you. And also very pleased to announce that Cayman Airways are doing more flights to Miami on the 5th and the 26th of June and on the 3rd of July. The 4 that they announced for June were sold out very quickly, so that's good news. Just some updates on figures, because I know you're all very interested in those. So since we closed our borders on the 22nd of March, 1,473 people have departed on emergency evacuation flights, and 314 people have been able to return home to Cayman on those flights. And last Saturday's flight to Manila was the 25th emergency evacuation flight to depart Owen Robert International Airport. We remain very focused on Jamaica and on India as well. And then finally, I just want to note that yesterday I met with all the members of the UK Ministry of Defence Security and Assistance team, known as the SAT. And after their isolation period came to an end. And I'm very grateful to them for all their work so far, liaising with the two Royal Navy ships, RFA Argus and HMS Medway, who will be coming to our shores around the 8th of June for a couple of weeks and providing us with helicopter cover whilst our police helicopter is off island. And the SAT team are also helping us on hurricane pandemic planning. They're supporting the development of our Cayman Islands Defence Regiment, on which we're making very good progress. And they're also supporting us around provision of medical supplies. And it's very good to have them here at this time to give us added resilience and reassurance and support. And they have a range of skills, including logistics, medical, legal, training, security, and planning experience, which we are finding extremely valuable. Thank you.
Thank you, Caroline. Good afternoon, everyone. Grand Cayman, Cayman Brac, and Little Cayman, and our Caymanian diaspora listening in. It's great that we had Miss Leah Johnson, a young lady, earlier, recognizing it's Child's Month. End the Child's Month with a prayer, and I thank you so much, Miss Leah Johnson, for that prayer. Also, wanted to thank Ralph, actually, for what he said about Cayman being a good place to be. That is sometimes taken for granted, I think. But Cayman is a great place to be, and I believe is blessed beyond imagination. And we have a great depth of gratitude. We need to thank our forefathers and mothers for all the decisions they took so that we could be at this point right now for everyone to enjoy Cayman. Let us not forget, for us to enjoy what most are calling a well-run gem in the Caribbean. It's very few of us left as Caymanians, but I am a believer that we should respect and appreciate what we found here. There has been a lot of changes over the last 25 years, and growth in the population has exploded, in some cases approximately 70% growth since 1998. This begs me to ask all who have come to our shores to recognize the adjustments we have had to make so swiftly and the mental effects this can have on any nation. We have been able to coexist with all passing in and out over the years, with over 100 nationalities living here. But at times, the rhetoric that we hear is begging to breach this unity. This country must benefit, and not just some. Everyone in the country must benefit. And as long as we are cognizant of this, all will be well. Love brings happiness. Without love, there will be no peace, no harmony, and no unity. Matthew 6:25-26. Therefore, I tell you, do not worry about your life, what you will eat or drink, or about your body, what you will wear. It is not life more than food, and the body more than clothes. Look at the birds of the air. They do not sow or reap or store anything away in barns, and yet your heavenly Father feeds them. Are you not much more valuable than they? Today I want to shout out Ms. Jane Solomon for all the work she does with placing Caymanians in jobs and being a champion of the Second Chance program at the prison. Also want to say happy birthday to Vincent Frederick. Also want to say happy birthday to Josie Minzit, 8 years old. It's come to my attention, and I'm sure the police are probably getting some complaints about walkers in the early morning at 5 a.m. Please remember to wear brighter clothes. This will be very helpful, and so we don't see any accidents out there early in the morning. Also, a number of community organizations have partnered together to deliver a series of motivational messages that will culminate tomorrow, the 30th of May, 7 p.m., with a concert and a mixture of global music offering and comedy. It's called Motivational Messaging. You can get on there by going on to motivationalmessages.org. I know we say it often, but there are some unprecedented times that we are living in. Only a few who are still alive today can say they have ever experienced anything of this level of crisis. And while we all have been adjusting to the global pandemic, many of us have been experiencing varying degrees of stress and anxiety, and even breaks in mental health. In the wake of this pandemic, one of the issues we have found people are now experiencing because of the social distancing or self-quarantine is cabin fever. Cabin fever is a common term around here, and it means the reaction to being isolated or confined for an extended period of time. Some of the common symptoms of cabin fever are lethargy, sadness or depression, trouble concentrating, lack of patience, food cravings, decreased motivation, difficulty walking, frequent napping, and hopelessness. I've been asked to note that these symptoms may also be suggestive of a wide range of other disorders. If any one of these symptoms are particularly distressing or impacting anyone's ability to function as normal, we encourage you to contact the Mental Health Helpline on 1-800-534-MIND, M-I-N-D. That is 1-800-534 or 6463 for free and confidential advice. The help you will find on the other end are some of the kindest and most knowledgeable people I've ever had the privilege of working with. I want to add here that though the progress has been slowed because of the pandemic, it only serves to motivate me further to ensure my ministry sees the opening of the long-term mental health facility in the very near future. If ever there's a time to truly appreciate how important this initiative would be now. For now, we are doing all we can to ensure everyone's physical and mental health is taken care of, and believe me when I say it is of this utmost importance during these times. I do want to offer a few tips that can be used at home to help in coping with any of these symptoms. But again, I encourage everyone who's experiencing any of these symptoms to contact the helpline or a trained mental health professional. We do not want anyone to feel as though they must deal with this alone. If you can, get out of your house, go outside for a walk or for some exercise, even if it's just a few minutes. Stretching for a few minutes a day has so many health benefits, it might surprise you. If you're able to take advantage of the opportunity to walk along our beautiful beaches, please do so, because the sunlight and fresh air can help regulate the body's natural cycles. And exercise releases endorphins, which have a pain-killing effect and can reduce pain. Of course, we ask you to adhere to the current regulations and requirements of social distancing. And when you can leave the house, find a way to stay physically active while indoors. Regular physical activity can help you burn off any extra energy you have from being cooped up indoors. There are many online resources available to help with finding exercises that can work for you, including yoga or high-impact interval training or other exercises outside with your family in the yard. Try your best to continue with your normal eating patterns and try to monitor eating habits. Do not skip meals and try to plan meals around the same time every day. Eat healthy, low-sugar foods, as balancing our nutrition keeps our immune systems healthy. Set daily and weekly goals and track your progress towards completion. Make sure that your goals are reasonable and reward yourself for meeting each milestone. It is best to limit your screen time and watching hours of TV. Try to stimulate yourself by doing crossword puzzles, reading a book, or playing board games with family members. You can play online as well if you are currently separated from your loved ones. This can help keep you moving forward and reduce feelings of isolation and helplessness. Try to stay social. Watch the local live stream events happening on the Department of Tourism's Facebook. Check out the community page on the government's website, government.ky/coronavirus, or the happy hour events that showcase local musicians. And reach out to friends, call someone different every day, and share what you've been up to and encourage them as well. And of course, visit the wellness page, which has so many useful tips and resources at www.exploregov.ky/mind, M-I-N-D. It is important to take this situation seriously while accepting the necessity of having to stay inside. There are many things you can do to help fight off the cabin fever feeling. Please also know that the government is doing all it can to move forward with its plan to slowly open back up the economy and get things to a new normal. But for now, please shelter in place and let's beat this virus. We will no doubt be able to move about more regularly soon, but I ask you to remember that for now, staying home is helping to slow the spread of the novel coronavirus. When you do venture out, you wear your mask and wash your hands as much as you can and stay the minimum required 6 feet distance from others. A reminder for everyone of the mental health helpline is 1-800-534-MIND. If you or someone you know needs free and confidential advice, do not hesitate to call. You are not alone. I just want to add a note here that all the frontline test takers, that they should log in to via the My HSA portal to see their test results. The HSA website is www.hsa.ky. We'll have more details on the mobile app and how to access it. I thank you, and God bless.
Thank you, Minister. Before we go to members of the media, some members of the public have got a few questions, some clarifications, if you will, for the Premier. And the first one was the increase in gathering numbers to 6. I believe that comes into effect from the 7th.
7th.
June.
7th, yeah.
And the question was is that in addition to members of your own household?
Yes.
So you could have a situation where each member of that 6 brought with them several...
No, the numbers wouldn't work then.
So if I'm a household of 4, I can meet up with 6 other people from outside that 4, so it'd be 10.
Right.
Perfect.
So, but the thing is that if each of you bring your whole family, you now no longer have a gathering of 6 people. Because you're not within your own household now, remember. It's your household and their household and their household as well. So that's the result we're trying to achieve, is still to limit the number of people who are exposed to each other while opening out gradually. But if everybody who goes to dinner decides to take their entire family with them, we rather defeated the whole purpose.
Exactly. And the second
But only 6 are allowed at a table in any event.
It was actually about that relaxation of the rules. Are people free to go to restaurants and bars under those the sort of criteria that you mentioned? Is that on any day of the week or with the alphabet?
That'll be any day of the week. That's not going to be subject to the A to K and L to Z division.
And would those separations still apply for members going to for people going to the supermarkets and so on? That system would still be
yes.
in place?
That system will still stay in place for all attendants at all retail stores, convenience stores, mini markets, supermarkets, banks. That's still in place. And the purpose of that, it's not arbitrary. It's not because we want to be difficult or overly restrictive, but that automatically reduces by half the number of people who are able on any given day to attend to in a particular facility. Coming back to the restaurants and the bars, rather than try arbitrarily to say that the number should be reduced by 25% or 50%, because not all places are configured the same way. It could be exactly the same square footage, but it may be more able to accommodate more people than another facility which is configured differently. The onus is still on the proprietor of all of these establishments to ensure that the distancing and other safety requirements are complied with. But in addition, the regulations provide no more than 6 persons at a table. Tables are to be spaced a minimum of 8 feet apart, and no service at the counter, the bar counter or the restaurant counter. So you've got to sit at a table and be served. Additional protocols, each restaurant and bar that is reopening and again, these are only the outdoor, those that have outdoor facilities. They will have to be required to submit to the competent authority their plan for reopening and the layout of the area that is going to be used, and obtain that approval. And all their staff will be required to wear masks when serving as well. So those are just some of the additional requirements that the competent authority will impose to, again, do everything we can to ensure that this is a safe reopening and that we don't have to do what is having to be done in many other places today, notably South Korea, where they've had another massive spike in the numbers. We are trying to go slowly forward rather than to go flying forward and then have to go back. I've said to the governor, my cabinet, and everybody else that will listen to me, I just don't have the strength to go through another massive lockdown again. Somebody else is going to have to do that. I'm going to Cayman Brack and hide if that happens. So we want to hasten slowly, but never have to reverse.
Great, thank you. I hope that clarification helps members of the public. Kayla, I'll hand over to you now.
Thank you. I imagine that these regulations will be published later today to answer a lot of the questions people have around what time might we expect a print copy.
They're going to be gazetted as quickly as the Attorney General's office can get it done. We hope sometime towards the end of today. They don't come into effect, remember, until Monday.
Yes. Okay, perfect. Thank you. And will diving be allowed under these regulations?
No, I'm afraid not.
Is there a reason that we're holding off on allowing divers to re-enter the water?
Yes, I can say so, but it's not. I'm going to try my very best to use the most polite terms, but it's not a terribly tasteful thing to talk about. We've gone through all of these things, believe it or not, with Dr. Lee and the public health team. So there is a lot of touching around and sometimes the use by multiple persons of the same goggles and snorkels and those other things. There's also a lot of saliva around these things, and all of these are considered to significantly increase the risk of transmission of the virus if those involved in it have it. And that's why diving is off limits.
Okay. Would there be any consideration for people who have their own gear, their own tank?
Well, the regulations make no such provision. I would just ask them to hang on for a little bit longer. The problem with exceptions for individuals is that we get questions from people like Wendy who say you're favoring one over the other.
Okay. And we're getting a lot of questions from working parents about how to manage the reopening of certain businesses, how people can return to work without access to childcare. Is it possible that families will be able to start having a nanny come to their home or be able to bring their child to a daycare center in the near future?
If all stays on track from the 22nd of June, but not immediately, this is a subject of massive debate and discussion right up until the very last when Cabinet approved these regulations a couple of hours ago, because it is a huge logistical problem for parents who have to go back to work. But the advice, the firm advice from the CMO is that the sheer number of domestics and caregivers that we are talking about, the manner in which most of them are required to live, that is multiple households within one home or apartment, as the case may be. And the fact that these people are coming into your home not for a short period, but for the entire day. They are touching everything that you have. They are washing your clothes. They are washing your dishes. They are hugging your children. They are changing your children. The risks are, if that individual has the virus, it is as almost absolutely certain that it will get passed on. And that demographic has not been tested at all, as far as we've been aware, unless they've been symptomatic. And there is still not sufficient evidence that it is not, the virus is not prevalent in that particular demographic. And so the CMO cannot and will not recommend that we reopen that sector yet. As I said, and we've talked about this as recently as yesterday, if the current trend continues and we get the restaurants and the bars open again for outdoor service, and we don't see, along with construction and retail, and we don't see a significant increase in the infection rate, which is currently trending now about 1.3, 1.4%, we should be able to reopen what I will call the touch services, as well as allow external child care and domestic help to come back into the homes with, we think, at that point, on the basis of that evidence, minimal risk.
Okay. One of the conflicts that I'm envisioning as people are returning to their workplaces is, how do you return to your office if you have young children at home? How do people navigate that situation? And is there any protection for workers who are forced to tell their employer, I can't come to the office because I have a toddler?
Yes, we know. That's exactly the discussion that we've been having. And no, there isn't any provision in the law that allows protection. We can just continue to do as I and the governor and the minister and others have been doing for the last almost 3 months now, is to appeal to the reasonableness and common sense and compassion of those who are employers, to understand the circumstances that currently exist. And now there really is, I wouldn't even say light at the end of the tunnel. I mean, we can see the end line if we stay the course. And as I keep saying, if we stay the course, all indications are we won't have to go in reverse, as just about every country that has rushed this has had to do. I wish I had some magic solution for how people deal with this issue and managing young children. I remember when I had 2 young children, and I can, my helper, even all these years later, is still very, very important to us, critical part of, I regard as my mother. She's been with me 28 years. So, but we can get by without her because we don't have young children. Although the myriad of things that we do now that we haven't done in many years, but we can do that. But I do empathize, and as does my entire government, with those who have young children and are faced with this dilemma. As I say, we can only appeal to employers to be reasonable and compassionate, and to understand that if a mother in particular cannot leave her children, don't cause her to lose her job over that. In 3 weeks, if all stays on track, you'll have her back in good shape, and she nor you should have to worry too much about contracting the virus from each other or from anybody else in the workplace, or indeed from the community, because we would have, if not completely have eliminated it, certainly significantly reduced the risk of it being passed on.
Okay, so it sounds like after the 22nd, we might see some relief announced for parents.
Well, I can be more positive than that. If I hate to even use that word positive anymore, I could be more certain about is that if the current trend continues, we will be able on the 22nd to release domestic and helpers and nannies back into the home.
Great. And another big category of questions is schools and education. And perhaps this would be something for the education minister to return to address. But first, are we still anticipating that exams, CXC exams, and others would continue this summer?
I think the last report I've had, and I hate to venture to areas that I don't really have a full grasp of the facts, but I believe that because of a decision that was taken by the CXC Council, the CXC exams are proceeding. They have taken a decision, these are the Caribbean-based exams, that they are proceeding. But if my recollection is not wrong, I think the UK-based exams have been deferred. But I can't be absolutely certain. And I hate to not really speculate, but trying to work from memory. I haven't looked at this in a while. But with schools, generally, the plan, I think on the present trajectory, we can look forward to schools reopening the usual time after the summer break, unless something goes terribly wrong that we don't foresee.
And, say that we do see schools reopening after summer break, do we anticipate that students would continue on to the next grade as normal, or would this be on a case-by-case basis?
Well, that would be decisions in the case of the private schools, for those schools, I think, and in the case of the public school system, obviously a decision taken by the Education Council in conjunction with the Department of Education and the Ministry. I can't answer that question today.
That's fine. One that you or the governor might be able to address is the issue of students studying off island. That I'm sure that there has been questions about that, if they'll be able to do that, and if upon return, if they'd be able to return in quarantine.
I mean, there is, Kayla, almost certainly a British Airways flight to London in around mid-August, because we're very aware there is a large group of students who need to go to UK for school and universities, so and families wanting to go with them. But obviously, the quarantine aspect remains very relevant, because the UK is now introduced that system for people going into the UK, and then people would have to quarantine at the moment on return here. And I know there are people who need to go to the US, but the Miami flights are the best route for that, and then people can get wherever they're going in the US from Miami.
Okay, great, thank you. And this may have been resolved already, but we got a message from a school bus warden who said that they have not been paid since March. Do we have an update on that situation, or should those workers apply to the NAU?
Okay, I hope they don't have to apply to NAU. I think we have sorted the problem from our end. But just by way of background, although we've had this before, so the bus contractors who transport school children on behalf of the Cayman Islands government have a contract which is based on the number of trips they make and the number of students that they take. So the challenge that the financial folk found, because they are not carrying out any services, not because of their fault, but because of this epidemic, this crisis, there was no trigger for the payments. Now the bus companies are responsible for paying the school wardens, the bus wardens. But obviously, again, they get paid on the basis of the number of trips that are made, so that their earnings are again tied to the number of trips that the buses make. So some bus contractors have gone ahead and paid their wardens from their own sources, while government has been trying to find a workaround for how can we justify in the sense of the financial regulations, payments for services which are not being rendered. So the appropriate workaround has been found. The ministry has put it forward, and Cabinet has now approved it. So that issue, I hope, should be resolved and implemented over the course of next week, and bus contractors can get their checks, and then hopefully they can pay those wardens who are still out of pocket.
Great, thank you for that. I will hand over the screen to the other reporters now.
Thank you, Kayla. Before we go to Felicia at Radio Cayman, I just wanted to, in my attempt to understand, I think I've further confused members of the public. They're asking for the avoidance of doubt. It's 6 people in total that can gather from the 7th of June. Is that correct?
Yes. Yes.
So members of your, if I have a household of 4 people, I can meet 2 others with them.
So, okay, let's see. So yes, correct. So if you are having, I even hate to encourage this, but if you're having, if you having I didn't want to use dinner party, but I can't think of another term. So if you want to go to one of the outdoor places, let's say Grand Ole House, and you book reservations with a table of 6, and there are 4 people in your family, that's fine. And you invite 2 of your friends, that's good.
Great.
But your 2 friends now can't bring their households.
So 6. As long as there's 6, we're fine. I hope that clarifies. I'm sorry for members of the public that I further confused there. Felicia, go ahead with your question. Hopefully it's slightly more straightforward.
Hi, yes. My question is actually for Minister Seymour. What are your thoughts on the COVID-19 posters that have been displayed on bus shelter locations across the island? How informative do you think they are, and how helpful do you think they are for the public?
I have to be honest. I haven't actually seen what you're speaking of. I don't know exactly. I know my 5-year-old daughter made one and put on a bus shelter. I don't know. I don't exactly know what you're speaking of. I'm so sorry.
Okay, it's fine. Well, next question. What are your thoughts on the various initiatives and programs being offered to the community on Zoom, including the upcoming Millennial Motivation Program? How effective do you think these programs have been since COVID-19?
Well, it's very effective, and we've been announcing a myriad of these events over the last couple of weeks. It gives people something to do and not just concentrate and I'm stuck at home. Gives them something to watch. Some people are bored. Children are bored, and they want something to do. They want to get out the house. So it gives the family something to do at home, and not make people feel so clustered and stuck at home. So I think any event like that, especially that one, it's actually an international event. It's going to be a lot of entertainers from about 10 countries are going to be joining in on Zoom for this event tomorrow. So it's like anything else, whether that's American Idol or Voice or whatever. It's just something to do,
Mm-hmm. Okay, thank you. That's all my questions.
Yeah.
Right, thank you. Cayman News Service, Wendy.
Thanks, Kayla. Thanks for that, Caroline. My first question is just to make sure that I understand. The question I asked earlier of the Commissioner about Sundays, I appreciate it's definitely happening from the 7th, but what's the situation for tomorrow? Is it still the same?
Sunday, you mean? Yes.
Yeah, so you still can't go to the gas station tomorrow? I mean, on Sunday coming?
No, and it's because of, as this Commissioner said, of the anomaly. Well, it's not a real anomaly. Certain businesses are allowed to operate on a Sunday, which is otherwise considered a prohibited day for trading. These exceptions are convenience stores, mini markets, gas stations, and some liquor stores. So we haven't troubled that legislation in what we are doing here.
Right.
That is in the prevention, control, and suppression of COVID-19 regulations, which are made under the public health law. But those regulations, the current iteration of which will expire on the 1st, do not permit persons to go out on a Sunday except for certain very limited circumstances. That is, to exercise or to purchase and collect prepared food.
Okay.
So that's what's created the anomaly. We recognize it's an anomaly. It's one of those sort of untidy things, but these regulations will expire on Monday. So we've just left it rather than trouble it and create even more confusion. So the new set of regs, when they come in on Monday the 1st, then all of that will go away. So essentially, this is the last Sunday, we hope forever, when this sort of situation will exist.
Okay, cool. I get it now. The next one is, which is also a bit sticky, but obviously something that's got to be addressed. As the economy opens up on Monday, even further, a lot more people going to work. What about buses? How are they going to get to work?
Yeah, well, buses, public transport has been allowed to operate since last week, Monday.
Oh, right. Okay. Sorry. As you know, I've been away off sick, so.
Right. So subject to
on the road.
Right. So it was one of those difficult ones, Wendy, because I mean, from a public health standpoint, but it is again one of those where you had to weigh up the risk against the practicality and come to a view, because so many of the people involved in the areas that are being reopened require transport because they don't have their own vehicles. Yeah. And so the sort of trade-off we did after a great deal of agonizing about it is we've restricted the number of persons who can be on a bus to half its normal capacity, and placed an onus on the driver to as far as possible to comply with the social distancing requirements. Okay. So essentially one person to a seat kind of thing.
Right.
Yeah.
Okay, so that's going to continue through the rest of the month. So that's that problem resolved. Okay, the next one is family reunions. So where you've had circumstances where parents have been split from older children or vice versa, is that still not going to happen in the next month?
So you can invite your family out to dinner.
That's it. So that's the only possibility. So
but you can't take them in your home.
Yes. Okay.
So again, this is not arbitrary or it is because the public health advice is that once people come into your home, you significantly increase the risk of transmission of the virus if they have it, because they're using your things, they're using your facilities, they're touching things, they're hugging you. It's much easier to control these things in a public setting than it is in the privacy of your home.
Okay. Conversely, on the other side of that, of like family reunions, which would have been likely to be older generation, younger generation, we're going to have the problem now of where we have multi-generational households where people have been locked down together, and now more people from that household are likely to be going out to work and bringing it back to granny. So has government thought about any offering protective environments, not exactly quarantine, but protective environments for those elderly people that are concerned or families that have concern that they can't protect their elderly with everybody going back to work?
What would those be? What would those look like?
Well, remember you said at the beginning, essential workers were allowed to quarantine in government facilities. They were offered rooms in government facilities so that they wouldn't bring the virus home to their elderly or vulnerable relatives. I was just wondering, given how many people are now going out to work, whether there's a possibility for government to be able to offer the converse of that, which is to give the elderly members of the family somewhere to go for them to quarantine from their potential, from the spread of the virus, from an increased number of their family members going out.
No, we haven't considered that. I mean, that now we're talking about some real serious logistical and capacity issues within the government structure and service, and even just the facilities were we to go down that road.
Yeah, complicated, I know, but it's just I was thinking, given.
I mean, even the facilities, the isolation facilities we have now are at capacity. So so there's only so much you can do when in the perfect world.
Oh, I agree.
I agree. In the perfect world.
The only ones that are remaining are just some clarification on what is actually going to open on the 7th. Does that include dentists being able to expand the services they offer, because they are part of the medical profession, but it seems that they've been kind of left to flounder a bit in terms of not being able to do anything. So will we be able to go get our teeth cleaned and fillings done?
No, I'm afraid not. only emergency services for dentists. They are in the touch service category.
Okay.
So they would.
So no special dispensation, given that they are medical professionals and know how to protect themselves and their clients.
No, until well, I don't necessarily keep a track of it, but I haven't heard really of any of them anxious to do so.
We've started to have quite a few actually, but
so
these are a more recent emergency.
Right. Dr. Lee is here. I'd forgotten he was hiding behind the screen. Maybe he can answer the question better.
Okay, yes, thank you.
So, Wendy, good afternoon again. The Health Practice Commission has previously released guidelines around all healthcare practitioners, which includes dental staff who are able to provide emergency and urgent services. And these have continued to be provided, certainly at the Health Services Authority. I don't know about the private dentists. I don't know them in so much detail. But I am surprised to hear you say that dentists are not able to work at all, because that's not a directive if they are able to provide urgent and emergency services. As far as I'm aware,
not their full range, because that's what it is really. It's
that is correct. The Health Practice Commission has not changed their recommendations. It's not a full range of services yet. But I hinted a few days ago that at level 2 it would be likely that healthcare professionals would go back to a full range, although that is a decision that would be joined with government's consideration and also the Health Practice Commission's consideration.
Okay, great. Thank you. Thanks for that. I've just got one more regards these. Where is it? Oh, yeah. Can the Premier please just clarify the businesses that will be allowed to open on Monday, aside from the whole of construction, real estate and retail? Does he mean every shop that sells stuff like clothes, everything? Can you just clarify the businesses that will be allowed to open?
Yes, it's all of those.
So office supplies, which have been delivering everything. So basically all shops except for presumably sort of spas and salons.
Yes, only those that I'm getting lots of hate mail as I sit here from those categories, but everybody else really, yeah.
Okay, great. Thank you very much. That's all I've got.
On that, actually, Premier...
That's all my questions.
Thank you, Wendy. A question about whether those retail outlets will have to apply for an exemption to the competent authority or whether they're granted.
Right. So the exemption is granted by the regulations. But what individual employees need if they're stopped by the commissioner's men or women is a letter saying, I am working for a business that has been exempted under the regulations. That's the reason why you write to the competent authority in most instances, except in those instances where the regulations allow the competent authority or require the competent authority to consider whether or not conditions should be, certain conditions for public health reasons principally, should be imposed, like with the opening of restaurants and bars and so forth. But the regulations exempt all retail and real estate and construction. But in the case of construction, they've had to get letters and so forth. So that's the reason why you need the letters.
My question was going to be about real estate as well, but you covered.
Yeah, they're covered as well.
In the same bubble. Okay, great. Any closing thoughts from members of the panel?
Well, just to say that I think we've decided that next week we'll do these press conferences on Tuesday and Friday, and beyond that we may move to having press conferences as and when needed rather than scheduling them on a regular basis as we get back more and more to a new normal.
Thank you. The great thing about cell phones and people listening in, thank you so much. Thank you for the question earlier about the signs on the bus stops. Rotary Central and the local businesses and the government got together and did these posters up about 6 feet social distancing, and it states that 6 feet saves lives. Staying 6 feet apart saves lives. One of the main reasons and the ways to slow down this coronavirus is, wearing your mask, washing your hands, and definitely your social distancing. You're 6 feet apart. It must be noted that social distancing only can work if we participate all together. This is what slows down or prevents the spread of the virus. And we welcome what the Rotary Central and the local business and government has this initiative. And I've actually seen a picture of it now. I hated to say that most of the times Premier don't allow us to go home until 9, 10 o'clock in the night. So we can barely see anything.
Thank you, Minister, and thank you to all of you for joining us this afternoon. A reminder that you can watch Child Month's Teen Panel on COVID-19, its impact on local teens. That's on CIGTV YouTube and the Department of Children and Family Services Facebook. And the panel will also be rebroadcast on CIGTV from Monday the 1st to Saturday the 6th of June at 6 p.m. So thank you very much for joining us. We'll see you next week on Tuesday. Stay tuned to catch up with the latest local and world coronavirus statistics.
Football Association.
Hey, fellas, we ain't gonna ever back down from nobody.
This is Alfredo Whitaker, president of the Cayman Islands Football Association.
I don't care who it is. This is a brotherhood. And if we stand strong together, we can't be denied.
Show your support. Your teams are working hard to be the best.
CIFA. Cayman Islands Football Association.
Building a better future for Cayman football.
If one of us go down, we have another. And another that's ready to fight.
Radio Cayman and CIFA, your team. 2020, your year.
So let's hit this field and bang them.
CIFA, Cayman Island Football Association.
Go out and support the matches in your district.
Funky Tank's Shen Road location is now open for deliveries, Monday to Saturday, 8 a.m. to 6 p.m. Call 949-0998, WhatsApp 916-0568, or email markw_ft@hotmail.com. Funky Tanks is your music and more store. Shen Road location now open for deliveries, Monday to Saturday, 8 a.m. to 6 p.m. Stay safe and stay home, Cayman.
The Lions Club of Grand Cayman would like to inform the community that due to COVID-19, the Benzorama fundraiser scheduled for June 6, 2020 will be postponed until further notice. New dates will be announced once government has given the all clear. Please continue to remain vigilant with your social distancing, hygiene practices, and home isolation where necessary. Wear a mask when out in public, and remember to maintain the 6 feet social distancing requirement. Do your part, Cayman. Stay safe, stay home, save lives. Together, we will win the fight against COVID-19. The Lions Club of Grand Cayman, proudly serving the Cayman Islands for 48 years.
More than ever, we need to ensure our friends, neighbors, colleagues, and family are staying well with social distancing. That means being creative. Call them regularly. Create WhatsApp groups. Offer to assist with shopping or running errands. You could use an app like Nextdoor to see if your neighbors need assistance while the world grapples with the latest challenges. Be Cayman kind. Cayman Insurance Center. For 45 years, they have worked with the community and their families on protecting themselves for the future. If you need someone to speak to during these challenging times, call Denise Brown at 814-7229 or Michael Webster at 925-5433. Cayman Insurance Center. They care about you.
Radio. With the switch of a dial, radio brings you tragedy, comedy, entertainment, information, education, a whole world at your command.
Give me some sound over here.
Radio Cayman's Super Jam Show.
Radio. Proudly sponsored by the Cayman Islands Football Association. CIFA, building a better future for Cayman football.
Word up, and we in effect. Keep on listening.
Super Jam.
The Super Jam Show is fueled by the proud sponsorship of insurance agent Michael Webster from Cayman Insurance Center. Don't take chances with your family's future.
Another proud sponsor of the Super Jam Show.
Merengue Town.
Time to feel the rhythm. Time to feel the vibe. It's time for Merengue Town.
And by the Lions Club of Grand Cayman, serving the Cayman Islands for 48 years.
This is from the Caribbean. Oh yeah, yeah, yeah. We showing love to the world. Oh yeah. Send a positive energy, and let the story unfold. Yeah. Everybody, let's go. This is the greatest show. Party in the island. If you're feeling the vibe, raise your hand. We all on the stage, and we come out to make we name. Oh yeah. Put your hand in the air and show me some love. Many lights, but one glow. You should know we spreading love to the world. In the streets, when we meet, tell them it's one family. All we is one, jumping we waving in the sun. We come out to have fun, hugging the party never done. 'Cause all we is one, jumping we waving in the sun. We come out to have fun, loving the party never done. 'Cause in these streets, we will be jumping up together as one. I say in these streets, when we meet, we will be jumping and pumping with energy. We are one Caribbean. We are Caribbean. We calling out to everyone. Oh yeah. We reaching out to your soul to be the greatest victory for every boy and girl. Everybody, let's go. This is the greatest show. Party in the island. If you're feeling the vibe, raise your hand. We all on the stage, and we come out to make we name. Oh yeah. Put your hand in the air and show me some love. Many lights, but one glow. You should know we spreading love to the world. In the streets, when we meet, tell them it's one family. All we is one, jumping.
When the crew gets together, they can't stop our shine. So let we do this forever. No more yours and mine.
Life sweet like